Hi, everyone. Good afternoon. My name is Jada Jefferson, and I use she, her pronouns. I'm a maternal and child health nutrition trainee and a Master of Nutrition and Master of Public Health student at the University of Tennessee, Knoxville. So welcome to the final Promoting Healthy Weight Colloquium. As Dr. Spence mentioned, this colloquium will focus on the 5 pillars in the Biden-Harris's administration National Strategy on Hunger, Nutrition, and Health, which were featured last fall at the White House Conference. We have asked our presenters and panelists to provide insight on their work to learn more about strategies to achieve the hunger, nutrition, and health goals for the United States. We acknowledge that everyone has different lived experiences, and some of the topics of discussion might be a bit triggering for some members of our audience and panel. So please feel free to move away at any moment to give yourself space to process and feel. As a student who is passionate about food and nutrition access, community health and wellness, and the built environment, I am excited to gain invaluable knowledge and tools today to better serve mine and my others' populations. So while I have my own experiences with hunger and other systemic issues, I believe the topics of hunger and nutrition should be shared and will be relevant to me and our entire audience, regardless of background and lived experiences. Our speakers and panelists come from a variety of educational backgrounds, professional expertise, and lived experiences. They will share some strategies to achieve hunger, nutrition, and health goals in their communities and beyond. I hope that all our viewers today can increase their knowledge about nutrition and hunger and are able to identify actionable ways to improve maternal and child health and well-being in their work and in their communities. So as far as statistics are concerned, we have enabled live transcript for all attendees and panelists. You should be prompted on your Zoom screen to opt into these services. If you have a question for our speakers, panelists, or colloquium hosts, please use the Q&A function. Although we will try to get to all questions as quickly as possible, we may need to answer some questions after today's program. For technical and administrative questions, email utphn@utk.edu. We will be monitoring this email throughout today's session. This email will be placed in the chat shortly after for everyone's convenience. The agenda for today's colloquium can be found at the link in the chat and on the first page of the resource guide, which is also available to the audience in the chat as a PDF format. Today's presentation and panel will focus on pillars 1, 2, 3, and 5. We will have 2 active breaks to help support physical activity for all, which is pillar number 4 of the national strategy. The first break is from 1:40 to 1:50, and the second break is from 3:50 to 3:55 Eastern Daylight Time. With that in mind, I'd like to introduce our first speaker, Dr. Jasmine Brown. Dr. Jasmine Jackson. Dr. Jasmine Jackson is the co-executive director of the National Black Food and Justice Alliance. Dr. Jazz is an applied food systems research and policy-based specialist. She partners with academic research team, anchor institutions, and philanthropic foundations, and community-based organizations to identify root causes of and develop innovative solutions to food system challenges. As a New Orleans native and farmer, she has developed a unique perspective when it comes to food and the effects that it has on communities. Dr. Jazz believes that your zip code should not determine your life expectancy, and building relationships is essential to creating a sustainable and just food system. Without further ado, the amazing Dr. Jackson.
Thank you so much. Wow. This is just overly amazing. Let me go ahead and start sharing my screen so you all can see this beautiful presentation. Let's see that I got some assistance with. Here we are. I'll start from the beginning. I'm going to take my breath on that. It's just such an honor and privilege to be speaking with you all today. I always want to give thanks first to God for directing my path and the ancestors for aligning my vision and my support system for ensuring I see it through. And thank you, Jada, for that warm introduction. I would also like to express gratitude to Marcia and the Maternal Child Health, Nutrition, Leadership Education and Training Program at the University of Tennessee for inviting me to speak. As the co-executive director of the National Black Food and Justice Alliance, I'm deeply humbled by the recognition extended to me and my organization. It is a testament to the collective efforts being made in addressing the fundamental issues of food access and affordability that disproportionately impact Black communities. I'm thrilled to have the opportunity to address the first pillar of the Biden and Harris administration national strategy on hunger, nutrition, and health. And I'm excited that this is going to focus on improving food access and affordability. This pillar is so crucial in ensuring that all individuals, regardless of their background, have access to nutritious food that promotes their overall health and well-being. I'll share some strategies and case studies to inspire community organizers and farmers and universities to collaborate and create a framework of community self-governance for building local and regional food systems. Additionally, I will discuss the Alliance's 2023 Farm Bill demands, which align with our goals of Black food sovereignty and liberation. And finally, I will conclude a call to action for all of you, our audience members, to join us in this important work. So today we've gathered not just as professionals and experts, but as champions of justice and equity. We've come together to explore how we can forge partnerships and create community-based actions to achieve food sovereignty in Black, Indigenous, and people of color communities. It's imperative that we identify and overcome the barriers that have perpetuated food insecurity and its adverse consequences on the health of mothers, children, and families. We cannot ignore the harsh reality that historically underserved groups have endured systemic disadvantages that have undermined their access to nutritious food. We must acknowledge the critical work that each of us are already engaged in to remove these barriers that are related to hunger, nutrition, and health. Whether you're a maternal and child health and public health professional, or an extension specialist or agent, whether you're a food bank or food pantry staff, an anti-hunger advocate, a registered dietitian or nutritionist. If you're a community health education specialist, maybe a student, a researcher, or a community member, our collective efforts are vital. And to dismantle these inhumane barriers, we must cultivate collaborations between community organizations, farmers, and universities. By harnessing the power of these partnerships, we can build a robust and sustainable system that ensures everyone has the access to healthy and affordable food. So as we engage in this dialogue, it's crucial to understand this broader context which our work is situated in. Hunger, nutrition, and health, they're not isolated issues. They're intricately interconnected, and their well-being of our communities is contingent upon our ability to address food access and affordability. When individuals face limited options and lack the resources to feed themselves and their families, the consequences ripple through every aspect of our lives. Our communities are facing unprecedented challenges, and it is imperative that we address these systemic barriers to create an environment where every individual can thrive. So now that I've framed where we are, I want to share a little bit about myself. So feel free to call me Dr. Jazz. I am a New Orleans Ninth Ward native, and I come from a long line of New Orleanians, and they are caregivers and hard workers. I attended New Orleans Public Schools and Xavier University and the Louisiana State University, LSU, and then graduated from the University of New Orleans for my entire undergraduate career. But I recently moved back home to New Orleans after spending 6 years in Alabama. There, I received my master's in community planning from Auburn University and a PhD in integrative public policy and development from the illustrious Tuskegee University. But my research focused on local food systems and how they created community and economic development. And personally, I feel that your life expectancy should not be determined by your zip code. I've lived and worked in the Ninth Ward and witnessed firsthand food disparities, and communities were constantly faced with the challenges that were stemmed from systemic food apartheid, in particular, the lack of access to affordable and fresh produce.
Dr. Jazz,
Yes.
I'm sorry. I think we're having trouble. Are you advancing your slides? We're not seeing them.
Are you
There
able
we go.
Sorry about that. I completely
No,
forgot.
it's okay. Thank you. Sorry to interrupt.
No, I appreciate the interruption. But I'll pause now actually to give, that's a picture of me, but I really want to share about Dara Cooper, our co-founder and former executive director. She helped us define food apartheid, and I'd love to share that definition. And it's not on the slide, so I'll just read it. You can find it in our Black food directory on our website. But food apartheid, the systemic destruction of Black self-determination to control our food, which is including land, resource theft, and discrimination. A hypersaturation of destructive foods and predatory marketing, and a blatantly discriminatory corporate controlled food system that results in our community suffering from some of the highest rates of heart disease and diabetes of all times. And many tend to use the term food deserts. However, food apartheid is much more accurate representation of the structural inequities that have been perpetuated through our current system. So in case you don't already use the term, I definitely encourage you to adopt food apartheid. But myself, I personally want to make a difference in the rebuilding efforts in my community. As I mentioned, I'm from New Orleans, so I decided to move to Alabama to pursue my graduate studies. And during my time in Alabama, I had the pleasure of being a community garden project coordinator. And that was actually in Tuskegee through the AmeriCorps Vista program. And I quickly learned that just like the residents in my hometown in the 9th Ward, community members in Macon County, Alabama shared similar sentiments in living in a state of food apartheid. So then throughout my studies in Auburn, there was just a recurring reference to policies and the amount of power the people who created them had, whether that power was good or bad, and the development of the success of a community. And that realization of the power, it actually led me to the PhD program at Tuskegee. And since then, I have been deeply engaged in food and land work in all aspects of my life. So much, I married a 5th-generation farmer and Tuskegee native, Terrence Jackson, last year. So now I'll share some about the National Black Food and Justice Alliance. But did I say how honored I am to address this important topic of improving food access and affordability, especially in historically underserved communities? So as the co-executive director of the National Black Food and Justice Alliance, which I'll keep referring to as the Alliance because that's a lot, but I am passionate about building partnerships and advocating for food sovereignty. So a little bit about the Alliance. We understand our work, it wouldn't be possible without the cooperative models that have been set forth by the resilient Black farming communities in the late 19th century and the Black power movements of the 1960s. A legacy of Black people audacious enough to confront violence with organization. A legacy that breathes life into our current movements, fighting to protect our Black bodies from police brutality and its intersections. And we recognize the food system as one of those intersections. And harm in the wake of Michael Brown's murder in 2014, the Alliance was established. And now we're a coalition of over 50 Black-led organizations to develop Black leadership, support Black communities, organize for self-determination, and build institutions for Black food sovereignty and liberation. We represent hundreds of urban and rural farmers, organizers, and land stewards that are based nationwide, working together towards intergenerational, urban, rural, and movement to map and assess and train and deepen the organizing and institution building, and also advocacy work, protecting Black land towards food sovereignty. So I keep saying sovereignty, and I love giving definitions. So don't forget to check out our website with our terms for Black food justice. But our view of sovereignty actually encompasses our mission and vision. And we feel sovereignty is the ultimate goal, but it cannot be achieved without confronting the question of governance. So we work to ensure that Black people not only have the right, but the ability to control our food through the means, but not limited to, production and distribution. The governance of our food systems must be rooted in the right to culturally appropriate food that's produced through ecologically sound and sustainable methods, and the right to define our own food and agricultural systems. But even in naming our rights, we know we will not enjoy any of them, which we will not assert through action. So shifting from an exclusively rights-based framework to a framework of governance and community power, it centers the needs of those working and consuming at all points of the food chain over the demands of corporations and markets. And we believe we can achieve sovereignty through democratic, people-centered forms of governance. And the way that we do this work is through organizing people, building institutions, and amplifying culture. We haven't been around too long, so it's a quick timeline of the Alliance. We started in 2015 and recently in 2023 launched our inaugural Center for Agroecology at the Florida Agriculture and Mechanic University in Tallahassee. So excited to see the growth so far and really thrilled to be on board. And I'll share this next part about, I already stated a little bit how we got to become who we are. And this is just a problem statement on things that members created together and just situating where we are in the world right now and why we need to do the things that we're doing, because we know that we're in a crisis moment and this is not something that we can wait. So how we do that work is really quick through self-determining food economies and also Black Land and Power. And in the self-determining food economy space, we are developing the pipeline of local and regional supply chain actors. We overall want to increase the capacity of Black sustainable food systems infrastructure, and that includes our supply chain work and cooperative retail work. And our overall goal is to weaken the impacts and dependency of the industrial and corporate agricultural system. So it looks like a lot of different things, but it's exciting work together. But we can't do any of that without the land. And that's where we focus on Black Land and Power to diminish the negative impact of land loss and land exploitation in Black communities and recover the land for community-controlled regenerative agriculture. And our goal for the next 5 years is excitingly to regain stewardship of 3,000 acres of land. So we are going to continue building our local coalitions and centering our land reform and defense practices and really focus on that protection, recovery, and retention. And I want to share now some practical solutions together that we can pave toward a just food system. We can identify pathways to build local and regional food systems that empower communities and foster self-reliance. We can do this by centering the voices and needs of the communities we serve. We can create resilient and inclusive models that drive lasting change. And we can do this by responsibly collaborating with community organizations, farmers, and universities to secure funding for research, training, and infrastructure development that's aimed at improving food sovereignty. And to foster these partnerships, we need to cultivate trust because we have to responsibly collaborate and we have to trust and respect and have some shared goals, not necessarily one-sided. But community organizations can engage with local farmers to establish direct farm to community connections, promoting locally sourced and culturally relevant food. Universities can provide technical expertise, research support, and resources to strengthen these partnerships and develop sustainable food systems. So one way that I know a university is working with one of our partners in Detroit, the Detroit Black Community Food Security Network. They've been around since actually before 2007, but since 2007, they've been represented by the University of Michigan's law schools. They have a community and economic development clinic, and they've been assisting in the opening of this amazing space. So it's going to be a food co-op, and it'll be opening in spring 2024. But this is just an example of how community organizations can establish gardens and farmers markets and prioritize local produce and support Black farmers. So really meeting people where they are and providing the resources. Detroit also, they have a D-Town farm that's connected with this, the Detroit Black Community Food Security Network. And it's a 7-acre farm that produces fresh produce and nutritious food for the community. And it's exciting to see how they're continuing to be able to provide this fresh produce. The store will be opening on the main street, and I'm really excited that my mentor and also co-founder of the National Black Food and Justice Alliance has worked so long to ensure that this is developed and in place for his community. I wanted to also share another case study here in my area in New Orleans, some success that I've been witnessing with the New Orleans Food Policy Action Council, which is an example of how farm to institution can really be fruitful in creating this opportunity of moving food sovereignty. to fruition. So there was a case study actually done by the New Orleans Food Policy Action Council on farm to institution and the feasibility. And they had some recommendations that are very relatable for any city or organization to take part in. And that's to continue to build fair and equitable procurement systems that prioritizes historically marginalized growers, have food service management companies to prioritize local procurement through internal policies, institutions to value an equitable and local food sourcing system, and policies that encourage and support local procurement, farm to institution programming. The study recommended these things, and I know that it's like the recommendations are nice, but seeing the implementation is where we really have to put our muscle to it. And I remember from my experience in Tuskegee and wanting to sell to the university's cafe and how many barriers there were in place about the bids needing and the travel miles, and none of that took in consideration local farmers and the value that their produce would bring. So excited about some possibility for people to implement, but also more of a success story in New Orleans through a Greener New Orleans campaign led by the New Orleans Food Policy Action Council and Sprout NOLA, along with the Growers Alliance of New Orleans. Recently, earlier this month, actually got legislation passed in the city government to increase urban agriculture access and through some platforms, specifically through lease changes. Before, there was only 1 year at a time where you can lease an open lot, knowing how long it takes to build up soil, definitely needing some longer leases and guarantees to be on land than that. There's also an issue with getting agricultural water meters installed. As a farmer, the water comes in and then goes back into the ground, but people in New Orleans were being charged for sewage, and that's unfortunate and definitely a barrier. So there's a policy hopefully being in place for that, along with being cited for blight, although it'll just be cover crops and above the limit for how tall your grass can be. So there's definitely some policy and people who are agriculture related needing to be in the places that are making these code enforcements. So we've excited to also put into this platform to appoint an urban agriculture liaison position that actually speaks and talks across city government along with farmers, as we know how difficult that can be. So excited to share some real-time opportunities and successes of communities collectively working together to build in some strategies. So I want to share now more about how we can build some self-determination, and that's through the community self-governance. And this is pivotal in building resilient and sustainable local and regional food systems. By engaging community members in decision-making processes, we can ensure that voices and needs are heard and respected. We can prioritize culturally appropriate food systems that celebrate traditional food ways, culinary practices, and cultural heritage by promoting community well-being and preserving cultural identities. Culture is so important to me, being a New Orleanian and knowing how inclusive it needs to be in our policies and city planning. And we need to promote all of these inclusive decision-making processes that actually involve community members, farmers, and academic partners in shaping these policies and programs that are related to land use, agricultural practices, and food system development. We also can evaluate and monitor. I know how many academics and funders need those evaluations, but there's impact of community self-governance initiatives on local and regional food systems. These indicators can be increased food sovereignty, economic empowerment, improved health outcomes, and reduced environmental impact. Also, we can continue supporting cooperatives and community-led initiatives, just like the Detroit People's Food Co-op I mentioned that'll be opening in the spring. They're creating economic opportunities that foster self-reliance. Also, the Federation of Southern Cooperatives and Land Assistance Fund, that's been instrumental in providing technical assistance and financial support to Black farmers, enabling them to establish cooperative enterprises and gain greater control over their economic destinies. Some more particular case studies that I know and witness from some real-time success. One of our members at the National Black Food and Justice Alliance, the Black Oak Center for Sustainable Renewable Living, It's located in Pembroke, Illinois, right outside of Chicago, maybe about 90 miles. And it's a shining example of community self-governance in action. They've established a network of small farmers, community gardens, and training programs that emphasize regenerative agricultural practices. There's a 40-acre eco-campus, and their goal is to restore 1,000 acres of farmland for Black land stewardship. And they know by taking control of their food system, the community has improved access to nutritious food and created economic opportunities, specifically through their healthy food hub market, which continues to introduce a mobile market, hopefully this fall. It is a moving piece and exciting to see and bear witness to an amazing organization doing work in a rural community right in Illinois. Also a case study that is not necessarily a member of the National Black Food and Justice Alliance, but also a worker cooperative that community owned. This community, Mandela Marketplace, they have pioneered a community-driven approach to food access. So they're engaging residents in decision-making processes, developing neighborhood grocery stores, and supporting local farmers and entrepreneurs. And through their efforts, they revitalize the local food system and empower the community to shape their own future. So I'm excited to continue to share success stories, and I know there are multiple cooperatives in the Alliance that are already with their storefronts or in the process of building their stores. So really excited to see this in real time, to see the shift in food sovereignty. And speaking of the case studies that have highlighted those powers of the community-based action to transform food systems, we have an opportunity as well. So to further our mission of equitable food access, the National Black Food and Justice Alliance has developed a set of demands for our 2023 Farm Bill. And we recognize the Farm Bill as a crucial piece of legislation, and it impacts our ability for our communities to access and feed ourselves. We have identified 4 key demands for the 2023 Farm Bill that aligns with our goals of Black food sovereignty and liberation. And these demands encompass key policy changes that are significantly impact the lives of Black, Indigenous, and people of color communities and advance our collective goals. So I'll present these demands and discuss their importance in achieving them a just and equitable food system. Our first demand is to improve our opportunities for startup expansion of local and self-reliant food economies. And this includes implementing the Justice for Black Farmers Act, which I'm excited to report that Dara Cooper, our former and founding executive director, worked with Senator Booker and Senator Warner's staff to work with Alliance members and other partners like HEAL to actually draft the Justice for Black Farmers Act. We can see the requests actually written in the legislation, and this act provides non-monetary equitable relief for Black farmers. We're also requesting to simplify grant applications and funding processes. I'm sure you are well aware of the time and dedication that it takes to receive funding for the important work that we're doing. But we're also requesting in the Farm Bill to support urban agriculture programs and research, as I showed earlier, how beneficial urban agriculture can be in creating food sovereignty. And also just wanting to be sure that there are additional programs that receive more funding for equal access for Black farmers and entrepreneurs, and all those that qualify, like the Farmer Promotion Program, the Farmers Market Promotion Program, and streamlining those processes to remove the barriers that'll actually support the growth of our local food economies. Our second demand is to invest in Black food sovereignty and an emerging Black food movement. And we must recognize the support for Black grassroots formations that are organizing for food sovereignty in Black communities. Additionally, we must restore, protect, and invest in Black land stewardship to ensure a viable land for generations to come. Our third demand for the Farm Bill is to include regenerative climate regenerative practices and programs as priorities. And we must divest from practices that conflict with restorative and regenerative land practices, and invest in regenerative agriculture practices and community-based solutions that promote climate mitigation and adaptation. The summary of our final demand is just to increase access for food assistance for Black and Brown communities who face crises of hunger and malnutrition. And this requires removing the existing barriers for food assistance programs, including the barriers that are faced by food workers, migrant workers, and meat packers. We also need to increase awareness and outreach around food assistance programs and ease the EBT point of sale for producers and cooperatives. SNAP benefits should be accepted on day one that grocery store cooperatives are open. You can find more of our demands, more ways that you can connect online. We have our National Black Food and Justice Alliance. Please do visit. But I just want to be sure that now more than ever is the time that we have to come together as a collective force to advocate for these demands of the 2023 Farm Bill. We cannot afford to let this opportunity pass us by. We must mobilize our networks, engage with policymakers, and amplify the voices of those most affected by food insecurity and systemic inequalities. I urge each and every one of you to join the National Black Food and Justice Alliance in our fight for a just and equitable food system. Together, we can build partnerships, create change, and pave the way for a future where food access and affordability are not luxuries, but inherent rights for all. In conclusion, I want to express my gratitude to each and every one of you for your dedication and commitment to this cause. By coming together today, we affirm our shared vision of a future where no mother or child goes hungry, where nutrition is not a privilege, but a fundamental right. Our collective efforts will shape a landscape where equity, justice, and nourishment are inseparable. Thank you so much for your attention. I look forward to hearing the remaining speakers as they talk about the other pillars and all of the transformative work we will accomplish together. Let us empower all our communities to have equal access, healthy and affordable food, ensuring a brighter and healthy future for generations to come. Here's our information. If you'd like to connect with us on social media, we're on Instagram and the things at Black Food Justice. You can email us at info@blackfoodjustice.org and visit our website, as I mentioned before, the Farm Bill demands, the Black Food Term Directory, all of those things, along with the Black Food Map, are resources that are on our website. But please note, the Alliance is actually closed on June 28th through July 9th in observance of our Trisha Hershey Summer Wellness Break. And Trisha Hershey's Rest is Resistance is a manifesto, and it reminds us that our commitment to this work does not have to come at the expense of our health and our well-being. In fact, to upend white supremacy and anti-Blackness as a standard, we must be in the practice of liberating ourselves too. So as an organization, we'll be disconnected from email, phone, socials. So please do reach out. And remember, survival is not the end goal for liberation. We must thrive and we must rest. That's from Trisha Hershey. Thank you all.
Thank you, Dr. Jazz, so much for that wonderful presentation. So now we are going to begin our Q&A session. So our first question is Jasmine and the Alliance finding good partners in North Carolina?
Yeah, I'm not sure if we're partners, Diane. Thank you so much for the question. One of our leadership and founding members, Mama Savvy Horn with Land Loss Prevention, is in North Carolina along with Operation Spring Plant. So those are our partners or members in North Carolina along with a few others, but I'd love to find out more information about good food in North Carolina.
Thank you. I hope you guys make some good connections there. So another question is, what can people do in their community to support Black farmers?
Yeah. Connect with them. Each farmer has different needs for sure, but I encourage you to build a relationship with your farmer. I love, love, love. I highly say this all the time. Ben Burkett is my favorite farmer. He's in Petal, Mississippi with Indian Springs Cooperative, and they come to New Orleans for farmers markets every week. And it's really important for me. I'm missing them this week on the market through my Zoom calls, but it's very important for me to continue to support Mr. Burkett and connect them with opportunities that I know, and also advocate for farmers to be institutional partners. So not just contracts with people, but also where our hospitals and our schools are purchasing food to ensure that we're making those connections.
Amazing. So sort of to piggyback off of that question, we have a question from someone who's anonymous. It says, I love that what you are doing. Do you see an area for an RDN within your area of work?
Is RD in rural development?
Oh, my apologies. A registered dietitian, nutritionist. Yes.
Look at the acronyms. I would love to be connected. I'm not sure of the work that's already happening. I know Xavier University is working on a food policy advocacy piece, but if there is registered dietary nutritionists in the area that would like to connect with farmers, and I know that there was a prescription program that was going on before where especially elders were able to receive free produce via prescription. So if that's something that registered dietitians RDNs can provide, or that connection, I would encourage, us to collaborate and, see how advocacy efforts can combine.
Yeah, there's acronyms everywhere and they just keep building on each other. Sorry about that.
No worries.
Okay, so another question is from Diane, and they say, how is the Alliance working and partnering with other Black food sovereignty leaders like Karen Washington, etc.?
Yeah, thank you so much for that question, Diane. These questions have been very thought-provoking. Karen Washington is actually on the board of one of our member organizations, the Black Farmer Fund. So we are connected, and I know that she was a part of the inaugural collaboration of what the Alliance is. This is a part of many, many ideas and people coming together. So this is nothing by any means my own doing or one person. So definitely connected with Karen and partnering with other organizations. We have over 50, almost 60 members now that are all throughout the country, but always looking to connect with others. And our membership process, in case you went to our website, will be opening hopefully later this year. We're taking some time to strategize internally.
So excited to see the growth of this. I'm very excited for you guys.
Thank you. I'm so excited as well, Jada. It's just amazing to witness and watch history in real time.
Amazing. Okay, so we have another question that says, what are your strategies to reclaim land?
Yeah, that's amazing question. So I would love for my counterpart, Kenya, who's our Black Land and Power Director, to be on the share. But currently through the Alliance, we have the Resource Commons Council that just launched last year, and it's member-led, and they're elected members of the Alliance to govern a set of funds. And I'll definitely share the press release that over $750,000 went to additional members of the Alliance that applied to this fund to actually either get infrastructure, rematriate land, or purchase additional land. So we have been working collectively on strategies that are including technical assistance, loans, and grants that are non-extractive. That's one of our governing bodies that we're doing to preserve and reclaim and protect land. We're also looking, saying this into the universe because we have been speaking this out, for an heirs property cohort, where heirs property, when you don't have a clear title in your family and there are multiple heirs that are in ownership and not able to pass it, or provide any equity or even a farm number, unless there's, the majority of the heirs assigned. We're looking for a cohort that actually clears the title of 5 to 10 families a year. So we'll look to start that really soon. We've been putting it out as something that our members have been requesting. And I know in my family, and also Kenya, who leads the work, we have similar situations that, it's going to go for members, but it's like, well, this is a resource more people should have and know about. So those are two of our ways that we're doing it as the Alliance, but we're also open to accepting land. We have been listening and learning through our first initial process of getting our feet wet in some land ownership, co-ownership strategies, where we're received an opportunity to steward 106 acres in Georgia, but they were still working out some finalizing pieces, but this came to us with debt that the funders ended up clearing the debt. So it is free, but it has farm animals, lodging where we're having retreats and training for more land stewards. So we are working on all fronts for reclaiming land. So thank you again for that question.
It's very important that this land is reclaimed and not sort of, I guess, sold back, if that makes sense.
Absolutely. I say stolen. I know people struggle, but over 15 to 19 million acres have been stolen from Black people through the processes of USDA, not clear title companies and cities just auctioning off land for people not paying taxes or not even knowing that their deeds are, theirs. So really excited to be, reversing that history and rematriating some of that.
Yes, thank you for bringing that to light for everyone. So we have another question, and it says, how does one get involved in advocacy?
Yeah, that is so important. As the Alliance, we definitely want people to connect with their local organization. We feel that building on the ground where we are to make a difference in our community is the first option. So do an Instagram or Google search. I know that there's a local community doing some advocacy work. There is all kinds of ways, especially in the Farm Bill, to be right in the heart of advocacy right now, as that's one of the hot topics. But I definitely suggest you to search around, ask people who are in health policy or nutrition if they are working with any legislators. But you also can always schedule a meeting with your legislator. And it may not be them. Don't worry, it's their staff. They write the bills. They write the responses. Like, I talk to them all the time. Been to DC, which is not actually as scary as I imagined. It is very cool to be in the big, ceilings and buildings, to just be there to speak with people that we pay to do this work for us. So I say, as a new advocate or emerging advocate or whatever, I never like to call myself an expert, but just get your foot wet in it and start with the organization. I don't always suggest going on your own. There are lots of resources out there. I know Heal Food Alliance is one partner of ours that are deep into the advocacy work. It's their first farm bill and they're doing amazing. I'm also working with the Union of Concerned Scientists. These are all national organizations that may have a member in your area. So go even on our website at the National Black Food and Justice Alliance and see if any of these members are nearby you that you may want to link up and see what kind of advocacy work you can do.
Thank you. I'm excited to see more advocates for the Alliance coming up soon.
Thank you.
And sort of piggybacking,
I was just saying that was a great question.
Sort of piggybacking off of local organizations, are you guys already connected to the Louisiana WIC program? And they were wondering specifically if there's anything that can be coordinated with WIC and local farmers using WIC farmers benefits.
Excuse me. Earlier, I mentioned the New Orleans Food Policy Action Council, which I know may or may not be connected with the WIC program in Louisiana, but I do have a request or a suggestion for people that are already in the work. As like I mentioned, the Alliance, we're on a national scale and allow our partners to do the on the ground work. But thinking about how amazing it is for my friends and family members to go to the farmer's market with their WIC voucher and double the portion for fruit and vegetables. Is not provided at every market because this is not a statewide initiative nor federal. It would be amazing if this policy was implemented in the Farm Bill, which you'll see in our demands if you check them out, because I did not want to bore y'all with all the policy, but we actually request that to be increased and also accepted on a blanket scale and not having to figure out when and how and which day you can use your vouchers when there's produce available.
It's amazing to see that your money can be doubled for fresh produce. That's so cool. I actually am in Tallahassee, and the Frenchtown Farmers Market does something similar where they double your access. Yeah, it's really cool to see.
Yeah, there's also a double of SNAP benefits, so that's exciting. I'm excited to hear that you're in Tallahassee. Would love to connect more with our Center for Agroecology out there at FAMU.
too. We'll be in touch. So we have another question in the chat from Diane, and they say, when did you say your membership would open up again? And is there a good reason to try and send people to your site given that they can't join yet?
Yeah, absolutely, Diane. Please visit the site. There's actually a waiting list that lets you know that we'll be opening membership soon, soon, soon. We're saying by the end of the year. We're not giving the exact season. We're actually voting on the process. Currently, we have a summer membership meeting coming up in July. And as I mentioned, it's 56 organizations. I don't know if I said that exactly, but we provide a democratic process and want to ensure everyone's voice is heard, and we move forward and with majority. So it is a good reason to visit the website. There's so many other resources there, more that I definitely did not have the time to share in the amazing projects that we're up to, lots of the media, but also that waiting list. Once we do open membership, that waiting list is actually on priority and will be potentially fast-tracked in some type of way and not have to wait the entire process of as others will once membership is open. We'll already have your information and can reach out and keep letting you know first dibs on as soon as we open. So please reach out.
So sort of in the meantime, what is the best way to support the Alliance's mission? And what is the best way to do that in terms of people wanting to go ahead and join? And then, yeah, sort of in the meantime, what can we do?
Absolutely. In the meantime, support Black farmers. Definitely, as I mentioned before, check out our website, see if there's a member near you. They may have some type of membership or way that you can be involved, a volunteer opportunity. There's advocacy work happening all throughout. So definitely go to our site. There's a list of members. You can click directly onto their website. There's also a Black food map. If you are a farmer or provide food in a Black community in some type of way, if you're a co-op, a food hub, food aggregation, farm stand, all the things, you can go on our site and fill out a form that you're actually going to be populated on a map. This is the only Black food map that exists. There are other maybe lists or directories, but we're excited to grow that. And that's definitely in support in connecting our supply chains and understanding where people are and the produce that they have. So excited about that. But also in the meantime, I think it's always doing some individual work. I've been thrilled to reread The Collective Courage book by Dr. Jessica Gordon Nimhart, and it speaks to the history of cooperatives and how that history is Black, and we've been deeply ingrained in community and self-governance, and there's so many barriers that are preventing that right now. So maybe there's a co-op in your area. Check it out, see what type of ways you can be involved. All those things are opportunities to continue our mission together to move forward for food sovereignty.
Thank you so much for those resources.
Absolutely. I see more questions are coming in. I don't know how much time we have.
So we have a little bit more time. Let's go ahead and tackle this one. So it says, how do you contribute to the fund to reclaim land, and what can the public do for this?
Yeah, absolutely. On our website, you'll see where you can donate to the Alliance. And if there's something you want to donate to specifically, you can definitely put that in the item. Also info@blackfoodjustice.org if you want to feel a more direct way. We have our information financial wise available, but that's the Resource Commons, which we are calling our project, and it's led by our Resource Commons Council in case you need that information when you reach out.
Thank you. And also for clarification, did you say the Black food map is on your website?
Yes, on our homepage, just scroll all the way down to the bottom and you'll see food map and directory. And it actually has Karen Washington, Dara Cooper, and another Black food advocates on the picture. So you might recognize it there.
Nice. Okay, and so is there a community land trust within the Alliance?
Not yet. That's actually something we've been exploring. We've been learning and creating I won't say a directory, but a list and network of existing community land trusts just to learn from what they're working on. And now we've been exploring how it's individual state-based with restrictions and rights and whatnot. So the national model may be a little difficult, but we are going to figure out what's the best way. And it may not be the Alliance holding the land, which we have no, feelings either way over. We just want to be sure that it's removed off of the speculative market and that we ensure that it's forever stewarded by Black people. So we're excited to continue to develop that process, but individually we're working to support our members and collectively building our land base.
Okay. I'm just going to check really quickly if there's any more questions that we have for you in the chat. Let's see. Doesn't look like we have any more. So if anyone doesn't have any more questions, we're going to go ahead and go on our active break, and everyone will be back at 1:50 for the next speaker. Thank you so much, Dr. Jackson, for everything, your wonderful resources and your wonderful insight. Actually, we do have one more question. I'm sorry.
Oh, no, it's okay.
So has the Alliance ever thought about supporting breastfeeding as one of their first and very local foods that Black communities and families can be receiving?
Thank you so much for that question, Diane. I personally am an advocate for breastfeeding. I won't say the Alliance as we're focused on our food and land, but I do know that it is very important for mothers and babies to receive the best nutrition. So I would encourage, other people who are in the stage of breastfeeding to go ahead and look out for your farmer's market and have a conversation with your farmer. Like, hey, do you have open visits? How are you growing your food? Not in like an inquisitive, like I'm the health, agency, but definitely wanting to be curious about ways that people are growing their food. So we are supporting farmers and moving to more organic practices and not harming the environment as we're looking to reverse some climate mitigation and damage that's happening to ourselves. So I appreciate those questions.
Thank you for that. Okay. And I think that one was the last one. So everyone can reconvene here at 1:50 for Eastern time. And I think I don't know what time that is in Western time. Someone had asked. I'm not entirely sure, but we can get back to you on that. And then once again, thank you so much for everything and shedding light on food apartheid and giving us definitions to sort of think and reflect on. And we're very excited to see what happens with the Alliance in the future.
Well, thank you so much, Jada. Looking forward to continuing the conversation.
Thank you.
Take care.
Good afternoon, everyone. My name is Candace Sapp, and I use she, her pronouns. I am a doctoral candidate at the University of Tennessee, Knoxville, and I have the pleasure of introducing Dr. Kofi Essel today. Dr. Kofi Essel is a board-certified community pediatrician at Children's National Hospital in Washington, D.C. Dr. Essel serves as Assistant Professor of Pediatrics, the Director of the George Washington University School of Medicine and Health Sciences Culinary Medicine Program. Ooh, that's a mouthful. The Director of the George Washington University Community Urban Health Scholarly Concentration, and the Director of the George Washington University Clinical Public Health Summit on Obesity. Dr. Essel has dedicated his career to advocacy and research around healthcare and public health workforce training, health disparities, and community engagement. With expertise and national recognition in the areas of addressing diet-related chronic disease, obesity stigma, and food insecurity in families. Dr. Essel sits on the National Academy of Sciences Roundtable on Obesity Solutions, Lived Experience Innovation Collaborative, and was nationally recognized by the Alliance for a Healthier Generation for helping to create an innovative curriculum to enhance pediatric resident trainee skills on nutrition-related disease management. Dr. Essel sits on the board of directors for FRAC and is a physician advisor for the Partnership for a Healthier America's Veggies Early and Often campaign. He also co-authored a national toolkit for pediatric providers to address food insecurity in their clinical settings with AAP and FRAC. He is the principal investigator of a large multidisciplinary population health initiative that aims to strengthen community clinical ties to address diet-related chronic diseases in historically marginalized settings in Washington, D.C. Dr. Essel has received numerous local and national awards for his professional practice, in addition to being selected for the top 40 under 40 leaders in health award by the National Minority Quality Forum. So as you can hear, Dr. Essel is well regarded in this field, and I actually had the opportunity to hear him speak earlier this summer in May at the Anti-Hunger Policy Conference in DC. And so I'm really excited to hear what he's going to share with our audience and our MCH team today. So without further ado, I turn over the screen to Dr. Essel.
Awesome. Awesome. Can you hear me? Can I get a thumbs up?
Yeah, you sound
Beautiful.
great.
Excellent. Okay, so I'm excited to dive into Pillar 2 today. Pillar 2, focusing on integrating nutrition and health. That's going to be my focus. That's going to be our focus today over the next hour of time. Let's go ahead and dive in. Okay, so with Pillar 2, with our focus on integrating nutrition and health, there are a few things that they are prioritizing in Pillar 2 in the White House agenda. Number one, prioritizing the role of nutrition and food security and overall health, and also ensuring that our healthcare system addresses the nutrition needs of all people. These are important aspects that we really want to highlight. There are three aspects of this that I really want to bring together that are categorized under this Pillar 2. Number one, we want to make sure that we're providing greater access to nutrition services to better prevent, manage, and treat diet-related diseases, thinking about using food as medicine solutions in particular. Number two, we want to make sure we screen, and not only screen for food insecurity, but intervene effectively. And number three, we also want to know and make sure that we're strengthening and diversifying the nutrition workforce, recognizing that the nutrition workforce can benefit from added diversity, whether racial, ethnic diversity, whether expanding nutrition education to other providers as well, so they can be more equipped to be able to have some of these basic discussions as well. Not to be dietitians, but again, to bring in a different concept and different component so to engage patients and families as well. So these are the areas that we're going to be focusing on as we go through. My objectives today are simple. Number one, I'm going to discuss the state of nutrition training and medical education. Number two, we're going to explain how interdisciplinary approaches to integrating nutrition and healthcare setting improves patient outcomes. And then we're going to also discuss the importance of using food as medicine as a solution to optimize health. And lastly, I'll give some practical strategies to integrate food as medicine in healthcare settings and systems. Let's go ahead and dive on in. So when I think about this topic, I wanted to really frame our conversation today. And in order to frame it, we have to understand some of the data. And you all who are on the phone, you know this data, so I'm not going to spend too much time on it. But we know that poor diet or poor nutrition is one of the leading risk factors for increased mortality and also increased morbidity, right? Quality of life decreasing. We understand that, it's quite clear. When you look at the data, what do we see? When you look at chronic diseases overall, you see that about 60% of US adults have at least one chronic disease. About 60%. When you go to 2, we see at least 40% of US adults have at least 2 chronic diseases. Now, when you focus in specifically on diet-related chronic diseases, there are a few things that I think are important to really understand. Let's start with hypertension. 1 in 3 adults, US adults, have hypertension. We talk about obesity, often 3 out of 4 US adults have either overweight or obesity. When you think about diabetes and prediabetes, what do we see the numbers to be? 1 in 2 US adults have either prediabetes or diabetes. And what many of you may know is that many individuals may not know they have prediabetes or diabetes. So that is a huge factor in itself. Now, with this fact, I think it's important to understand and call out diabetes. Diabetes adds one of the highest costs on our healthcare system. For every $1 spent, or 1 out of every $4 is a better way of saying it, one out of every $4 spent in healthcare goes towards diabetes in particular, right? And you can break that down in a variety of ways. But if you think about it in general, we spend about $327 billion in healthcare costs towards diabetes. About 70% of those dollars are on direct medical costs, and about 30% of those dollars are on lost productivity. So we understand this to be a big burden on the healthcare system, and we understand that food and nutrition can end up being a leading risk factor to triggering and leading individuals towards having diabetes, type 2 diabetes in particular. So this is something that we understand. Now, with this added cost on the healthcare system, the Rockefeller Foundation did a wonderful analysis looking at the role of food security and diet-related chronic disease on the healthcare system, and we're looking at nearly $1.1 trillion of spending each year as a result of these factors. So we recognize that the risk is high. We recognize that this is a very prevalent issue that we need to do something about. So as a result, you would imagine that we as healthcare have done a phenomenal job training the next generation of providers to be equipped to be able to talk about this topic of food and nutrition. Let's look at the data. What we've seen in the data is quite interesting. At minimum, at baseline, we say that there should be a minimum of 25 hours of nutrition education provided in medical schools to prepare the next generation of providers to be amazing at what they do. 25 hours is the baseline minimum. What do we say around that? What do we notice as a matter of fact? We see that the majority, 70% of these schools don't provide even those minimum number of hours of 25 hours. What else do we notice? A third of these schools don't even provide half of those hours. When you get to your third and fourth year, those practical years of medical school where you're in the ward, seeing patients in the hospital, getting a lot of practical skills, we see that the majority of programs don't focus much of their time at all in incorporating nutrition education or nutrition tools in terms of teaching students how to engage patients around these tools in medical school. So in general, what do we notice? That there's very limited education around nutrition in medical training. It's clear, we understand it, it's a problem. But of course, it may be different when you're talking about resident training and fellow training or faculty. They must be much better trained, right? Well, the data is pretty clear there too. We see that residents, fellows, practicing clinicians, they all say the same thing. We do not feel prepared to engage this topic with our patients and our families. At the same time, we all consider ourselves experts on food and nutrition. Why is that? Because we all have our own lived experiences with food and nutrition. We all recognize how food and nutrition makes us feel. So although our knowledge may be lacking, our ability to communicate with our patients sometimes is overwhelming in terms of, we say a lot of things to our patients sometimes that may not necessarily align with the data. It's things that we may have tried, things that we've heard, things that may be good to consider. But oftentimes these are stewed in stigma and bias towards our patient, not recognizing cultural background, not recognizing the diversity of palates, not recognizing the importance of meeting our patients where they are. So there's a challenge here. There's a gap here. And these gaps need to be filled. And Pillar 2 highlights the importance of improving nutrition education for medical providers. Now, one of the areas that I think is quite unique and has been a phenomenal godsend in getting us to be aware of the importance of talking about nutrition in medical education is a renewed focus on social determinants. This idea of social risk, of social needs, recognizing that, hey, it's not that a family has a diet-related chronic disease, so just eat more fruits and vegetables. It's about realizing that there are a multitude of other factors that influence the health outcomes of our patients and our families. And once we become aware of that, then we become more sensitive to creating more strategic and beneficial public health strategies and having more empathy in our clinical spaces to be able to meet our patients where they are. One of the most important social determinants or risk factors that we often talk about, especially in this discussion around diet-related chronic diseases, is what? It's food insecurity. Food insecurity, what is food insecurity? When all members do not have consistent access, all members in a household do not have consistent access to enough food to live an active and healthy lifestyle. When all members in a household do not have consistent access to enough, I will label, healthy and nutritious foods to live an active and healthy lifestyle. We all heard this definition. We often interchange this word with hunger, although it's technically different, but to understand it at the way we want to understand it, we can overlay it in today's conversation. So we understand that people experience hunger. We understand that this is a big factor in influencing the health of populations as well. With a renewed focus on social determinants, a renewed focus on food insecurity, we saw professional organizations around the country really take this on. For example, the American Academy of Pediatrics, they put out a policy statement in 2015, groundbreaking policy statement addressing this for the first time, really encouraging providers in clinical spaces to advocate for policies that end childhood hunger, to screen and intervene in clinical spaces, to bring this up and to figure out ways that we can do a better job of addressing this topic in the clinical spaces that we're in. The AAP policy statement said this: pediatricians can play a central role in screening and identifying children at risk for food insecurity and in connecting families with needed community resources. Really powerful statement, a powerful statement that you all could read it when you get a chance. Another group that came out was ACP, the American College of Physicians. They said this: They believe it is imperative for the United States to make it a goal to eliminate food and nutrition insecurity and recognize the fundamental right of adequate access to healthy food. These goals and actions are aligned with longstanding ACP policy. This is something that we are saying it aligns with what we do as doctors. We need to be addressing this. How do we address this well? You also have the American Hospital Association. They said this: food insecurity is a social determinant of health that should be accounted for in any population health strategy. Food insecurity affects the health status of individuals and families on many levels, so hospitals are treating it as a health care issue. We have a renewed focus on bringing this to the forefront, recognizing that to improve the health of patients and families, we have to think about the systems that influence health outcomes as well. When you look at some of the national trends around food insecurity, what do we see? Why is this such a big deal? Well, in general, the most recent data from 2021, the national data, what do we see? So in general, when recession hits, you can see here from about 2001 to 2022, when recessions hit, you can see spikes in food insecurity rates. You can see this last spike reaching levels up to 14.9%. All households experiencing food insecurity. These rates went down significantly over time. And then that we thought with the onset of COVID, with us seeing the long lines, with us seeing, the increase in SNAP use, food pantry use, food bank use, we thought that there's going to be another significant spike as well. But nationally, what did we notice? We noticed that some numbers were high, some numbers were low, but in general, we saw numbers remain steady from the year prior to COVID. What does that tell us? It tells us that when we have the political will, we can actually do this in a more positive way to help to buffer and even reduce food insecurity. What do I mean by that? You think about all the policies that came out that really supported families and helped to buffer food insecurity, supporting SNAP, taking off some of the burdens to be able to onboard into SNAP, allowing SNAP maximum benefits to increase. All of these kind of changes, WIC enrollment, all these things really supported families. In addition to charitable food response was significant as well. You saw a huge number of families taking advantage of food pantries and banks in a way that they hadn't before. It became a part of the national dialogue. The most recent data in 2021 showed us that we're at our lowest rates that we've been in 20 years, which is no different than that 10.5% for the most part. But about 1 in 10 households experience food insecurity, about 10.2% of households. Now, when we look at households with children, what do we see? We see, again, with recessions, we see a spike in numbers. We see with COVID, we actually did see a little bit of a spike from 13.6 to about 14.8%. But then the most recent numbers in 2021, we see that the numbers have been the lowest that they've been in the last 20 years as well. Again, speaking to the importance of that strong political will, speaking to the importance of addressing this in a way that it taps into our resources that really make a difference. When we talk about this topic, it's sensitive, but we need to talk about the importance of how all poverty is not created equal. What do I mean by that? When I started to look into COVID-19, when I first started to explore it, what did I start to see? Well, I used to call it the great equalizer, right? At first, I would hear about prime ministers, Tom Hanks, all kinds of important people. I heard about people with great wealth, people with not so great wealth getting COVID-19. So I felt like, hey, this is equally affecting us all. But as we continue to gaze more and more into COVID, we realized that it was more than the great equalizer. It actually was the great magnifier, magnifying inequities that had existed all along and finally being thrown into our face in a way that we had to do something about it. For example, the first few months after COVID, looking at food insecurity rates, looking at a special tool that was used by the USDA, what did we see? We see that all households increased significantly when it came to food insecurity rates, all households. But some households increased more than others. These rates, the prevalence of food insecurity was already off. It wasn't consistent with all households by race and ethnicity. But we see that these inequities actually spread. They became worse when we started to see them a little bit more closely. So what did this highlight? It highlighted the systemic injustices, racism, these other factors that influence what we see today when we look at these disparities that exist across the board. 10.2%, you may say, well, that's not that big a number. 10.2, I mean, there's 90% of people not affected by that. What is this really telling us? This is telling us about 14 million households, about 34 million individuals, about 9 million children are experiencing these toxic and palpable stresses of food insecurity, where on average, most families experience this about 7 months out of the year. Families going to bed hungry, families experiencing these toxic and palpable stresses. And this is a disservice that shouldn't be the case. And that's why you see that Pillar 2 really highlights the importance of screening, identifying this, and then connecting families to meaningful resources. When you look across the board, we see that some families are affected by food insecurity more than others. Some families have higher rates or higher prevalence of food insecurity. You can see families with poverty, even all the way up to 185% of the poverty line. Single parent households, communities of color, households with children, rural and urban settings, households in the South, single men or women. You can see these households being higher. And you may say, well, I just need to really look for these households when I identify families experiencing food insecurity. But the reality is, as Feeding America has shown us, is that food insecurity is actually ubiquitous. There's no county in this country free of food insecurity. In fact, I also like to describe food insecurity as being invisible. If you rely on these superficial signs, weight changes, certain signs, you're using certain kinds of insurance, how you may look, these superficial signs do not tell you anything about a patient's having food insecurity or not. And in fact, food insecurity is an invisible factor, and we need to use powerful screening tools to be able to identify if families are experiencing it. Because if we leave it up to our own biases, we're not going to get anywhere with that. So you may ask yourself, like, why does this matter? Where did these two worlds come in with food insecurity and diet-related chronic diseases? Well, what do we see in the data? We see something really interesting. Food insecurity is actually associated with worse cardiometabolic disease. Look at what this study showed us here. This study was an analysis looking at different NHANES cohorts, and we see that when families experience food insecurity or individuals experience food insecurity, they have higher rates, statistically significant higher rates of these conditions, things like diabetes, hypertension, heart disease, even obesity. These are things that we see. So we know that this association is quite significant, and other data points have shown us this as well. So it's not just food insecurity by itself, but it's that this is associated with worsening cardiometabolic disease, which in itself, we talked about, these diet-related chronic diseases tax our healthcare system. They tax the health and the satisfaction and the quality of life of our patients and our families as well. So you may ask yourself, what do we do? We talked about food insecurity, we talked about diet-related chronic disease. Is there a way to kind of bring these worlds together? Is there a way to think about how we can address this work more effectively? Well, one of the ways in which we do that is a term that many of you may have heard of, but if you haven't, let's introduce it today. Food is medicine. You may say, well, I've heard it being called food as medicine. I heard it called food was medicine or food will be medicine. Doesn't matter what word you use in between. Food is medicine is a concept, is a strategy, it's an intervention that focuses on collaborating, working alongside healthcare to either prevent, manage, or treat diet-related chronic diseases with increasing access to quality foods. This is also an intervention that can be used to address food and nutrition security quite effectively as well. When you think about food as medicine, there's a pyramid that a lot of people often talk about. And this pyramid I'll show you is right here. This pyramid is looking at the different levels of addressing or using food as medicine as a tool. At the bottom, you can see tools that are using prevention. At the top, you're seeing a greater focus on treatment. So you can see at the bottom, you're seeing sort of population health food policies and programs, policy councils, policy that we're intervening with, sugar tax policy, different things like that. As you go upstream, you can see here government nutrition security programs. You can say programs like SNAP or WIC or school meal programs. These are programs that we know can be quite effective and evidence-based in improving overall health outcomes, reducing poverty, reducing food insecurity, and the list goes on and on. These top three are programs I want to focus on a little bit as well. Medically tailored meals, medically tailored groceries, and produce prescription programs. These programs can be quite effective and poignant at addressing diet-related chronic disease and food insecurity, and let's dive into those. And I'll start with program number one, medically tailored meals. These are sometimes considered the most expensive of these programs. They have some of the most robust data, RCTs being done, control groups being seen, really effective data. We still have a lot of questions like we do with all of this stuff, but in general, we see the effectiveness with these interventions. Typically, you're providing more than 50% of the caloric needs of a household or an individual. You're also providing foods that are pre-prepared, right? These are items that are pre-prepared and oftentimes delivered to families. They're designed by dietitians to oftentimes meet a need. So addressing diabetes, hypertension, rehospitalization, different conditions like that. And these are really great programs that you can see being used all around the country. The next category of programs I call is medically tailored groceries. Again, not just produce, but produce plus, right? Thinking of things such as whole grains, beans, other items as well that you could be incorporating into these packages as well. The amount of food typically varies. You're typically giving, again, a mix of produce and other grocery items. The cost of this is going to be far cheaper, right? Because you're not preparing items, you're not pre-preparing items. These foods can be delivered, they can be picked up, they can be used through a food pharmacy approach as well. And the last category I want to focus on is produce prescription programs. These are, again, another really powerful strategy to use food as medicine. Again, a cheaper cost, you're only providing produce. It can be fresh, frozen, or canned. And these are items that are used, sometimes designed to improve overall health of families as well. And you may say, well, what evidence do we have that these programs work? It's food. Like, food can't really be medicine, right? Well, we know that these programs can be effective in a lot of different ways. We also know there are a lot of questions that we have around the dosing, the frequency, all these things we still want to really dive more into. But what do we know? We know that these programs can be quite effective in decreasing ED visits, decreasing hospital readmissions, improving overall dietary intake, decreasing blood pressure, decreasing food insecurity rates. The list goes on and on and on. And it's important that we understand this and recognize what we can do to use this as a tool to address diet-related chronic disease and food insecurity. So pillar 2, what does it do? Pillar 2, it encourages us to use food as medicine to improve access to nutrition services. Pillar 2 encourages us to screen and intervene to address food insecurity. And pillar 2 also highlights the importance of strengthening and diversifying the nutrition workforce with education and also with creating strategy to improve the diversity that we see across the workforce. All right, so in order to do this diversity, and when you do this diversity, we know we then are able to do what? Provide healthcare with systems that address the nutrition needs of all people. And this is another important piece that we have here. So I want to give you a case study application of this work that we're talking about around pillar 2. So in 2016, I was part of a team that rolled out food insecurity screening within all of our clinics, our primary care clinics at Children's National in Washington, D.C. We see more than 40% of the kids in the District of Columbia. A lot of opportunity there. And you can see that the policy statement came out in 2015. We're one of the leaders in starting to roll this out and learn strategies to do this effectively. Here's a toolkit on the side that we worked on in 2021. This is the most recent toolkit that trains providers and equips providers on how do you screen and intervene effectively, recognizing the power of screening and then intervening to improve the health of patients and families. Our providers were saying a few things. They said, hey, we like these programs. I didn't know food insecurity existed in the rate that we're seeing it. It blew my mind. And when I saw this patient and I saw what they were wearing or what they brought in, I never could have imagined that they had trouble experiencing food insecurity. They also said, hey, I want to give my families more meaningful intervention. A piece of paper with resources, it's great. It's fantastic. But the reality is that piece of paper oftentimes doesn't leave that exam room. It oftentimes doesn't make it into the trash can. It oftentimes doesn't even go down the elevator with them. It just stays where it is. It never comes out of the purse or the bag or the pocket. We want to think about strategies that we can create better warm handoffs, strategies that we can create what we call clinical community collaboratives. We looked for different models that were out there, and we came across a really powerful idea, designing what we call clinical community collaboratives. These collaboratives allowed us to work with community partners, share data back and forth, prioritize health equity, and center the family in the middle of everything that we were doing. This became a really important piece for us in our design. So we started doing this work in the city and the community, and we realized there were great partners who are already doing some fantastic work. Community-based organizations already being recognized as anchors in community who are doing phenomenal work. That what would it look like if we partnered with them? They're already doing phenomenal work. How do we bring our forces together? So what we did was we designed an initiative. We call this FLIP, the Family Lifestyle Program. We brought together the YMCA, Children's National, and the American Heart Association. And we designed FLIP to be an intervention that created more meaningful strategies that address diet-related chronic disease and food and nutrition security through a family-centered lens. We really wanted to focus on creating healthy families and healthy communities in what we were doing. And this is our initiative that we created. You can see some of our team members here and some of our funding support that we've received as well here. We have a community advisory board that oversees our work and has been part of our work from the very beginning as well. Now, I'm a pediatrician, and a lot of this work around food is medicine. We don't often think about young kids. We don't often think about children, right? We're thinking about adults, and the burden of disease is, it's oftentimes with adults. That's where the highest cost is. But for me, it's always important that we realize that we cannot forget about that next generation, because that next generation ends up becoming older and then has that layered diet-related chronic disease that we may see. So how can we think about doing this in a more meaningful way and think about addressing conditions early on? One of the groups that we often forget about in particular is our youngest of children, those who are the age of the first 1,000 days. You all may know about the first 1,000 days, and this is a group I really want to highlight in our conversation today. The way I want to start this conversation is by telling you a little story. I remember when I was a resident in training and becoming a budding pediatrician, learning everything from books and thinking I knew everything. I remember sitting in front of a patient. They brought in a 4-month-old, a beautiful family like you see here today. I remember the family looking at me and saying, "Hey, Dr. Kofi, we're excited. Our child is growing. We're ready to start solid foods, and we want to figure out how do we go about doing that effectively. What is this? What do we do? We hear that this is important." And they looked at me, and I realized I didn't have the answers to what they were really looking for. And I looked around and I realized I'm by myself. I need to figure this out. So of course I run out to the attending, the head doctor who knows everything. And they realize, they come back into the room and share information. And the advice that's given is also not very valuable to the family. The family leaves not feeling fulfilled, not feeling they had an answer or a strategy in how to address this topic. And I realized at that moment that we failed this family. I realized at that moment when I started asking my colleagues around the country and realizing that they also had no experience in this topic and didn't know how to communicate about strategies affecting children around nutrition, especially our youngest children. I realized something. We have to do better. We are missing an opportunity. The first 1,000 days, the brain is developing incredibly fast. We have opportunities here where sudden insults to the brain, certain traumas to the brain can cause permanent changes for their life. So we have an opportunity here to transform the palate of young children, create a palate that enjoys the adventurous appetite of a variety of fruits and veggies and umami flavors and earthy foods and sour and bitter, or we can just get them used to one flavor. This is an opportunity that we were missing out on. I wrote about this in AJPH a few months ago, and I was talking about the opportunity for pediatricians to intervene in those first 1,000 days, recognizing all that we know in those first 1,000 days. We know that 90% of adults don't consume enough vegetables. You can say fruit or vegetables. And then if you think generationally or behaviorally, we see something else that's interesting. 90% of children don't consume enough of the recommended fruits or veggies. This is a problem. If we're not consuming enough of them, we can imagine some of the issues we may be having, issues around our microbiome, issues around consuming enough fiber, and issues around constipation and bloating and all the other issues that can be a result of these as well. We know that this is a big factor that we're seeing here. When you look at the data, we see something interesting. When you think about how many families or what families are consuming, we understand that the strategy that oftentimes we talk about for adventurous eating or for getting young children to eat a variety of foods is what? You got to give those foods multiple times. That's all you got to do, right? Just keep giving it. 8 to 15 times is what some of the data tells us, right? And I've seen numbers all over the place, but let's take it here today. 8 to 15 times on multiple days. If you just give those foods 8 to 15 times, your young children will enjoy them. They will start to adapt to these different foods. Their palate will transform. That's all you have to do. When we say this and we don't think about the systems and the environment that some patients are in, we're missing something. A lot of times when I communicate this to my families, what they may be thinking, the first thing they may be thinking is what? Waste. If I'm giving a food 8 to 15 times, I may be wasting this food 7 to 14 times. That waste may be too much of a burden for my family to handle right now because of the challenge around food access, getting quality food to improve our lifestyle. What do I mean by that? Let's look at a pathway or sort of a continuum when we think about food insecurity in families. When I think about food insecurity in families, I typically think of a few things that happen. We have a financial hardship that suddenly occurs. With that financial hardship, the first thing that oftentimes drops is what? Is food. Why? Because that food budget is so flexible. That food budget is so fungible. So as a result, we see food oftentimes decreasing. What do we mean? So the first thing we tend to see is this idea of food anxiety, a constant preoccupation, perseveration with where one's next meal is going to come from. That oftentimes, that food anxiety, what one of my colleagues out of UCSF says, Dr. Hilary Seligman, she describes it as a decreased cognitive bandwidth that can occur, right? So one's cognitive bandwidth, the ability to shift and focus on many things, becomes hindered because of this very nature of this toxic and palpable stress of food insecurity. What happens after that occurs? Well, the first thing that we tend to see after that is the quality of food begins to drop. We call this a monotony of the diet. The diet becomes very monotonous, very simple. We're getting the same things over and over again. Why? We don't want to waste those foods. We oftentimes may gravitate towards foods that are higher in sugar, salt, and fat. Why? Because these ultra-processed foods oftentimes are a pop-off valve for the brain, the dopaminergic relief, the gravitation towards those foods, the feeling that comes from consuming those foods oftentimes are also cheaper. They're hyper palatable, easier to access as well, which also may adapt and change people's behavior and also purchasing patterns as well. After you're seeing this variety decreasing, right? And we talked about with food insecurity, this waste concern. After you're seeing this occur, the next thing, of course, that happens is the quantity of food decreases. Adults love their children, so adults will decrease their food intake first. And then lastly, children will decrease their food intake last. Now, adolescents and younger children, they oftentimes will describe in the literature that they'll decrease their food intake as well. They oftentimes know what's going on in the home, although parents are trying to protect them from knowing about food insecurity. They oftentimes will eat less so that their younger siblings can eat more. So that toxic and palpable stress is felt through this whole journey for families, even if there is not a decrease in the quantity of food. I love how Ellen Satter, our famous dietitian, says this. She overlays Maslow's hierarchy with food insecurity and kind of puts these two worlds together and shows us a really nice model here. If you look at this model, what do you see? The first thing that families are oftentimes trying to achieve is not getting those novel new foods, that what I often say, that kale quinoa bowl that you may recommend from the clinical office, but they're oftentimes trying to get enough food. If you think about the first 1,000 days from conception, right, to age of 2, if you think about those first 1,000 days with that incredible rapid brain development, especially after birth, what do you think is happening? Families are trying to do something in particular. They want to make sure that their children are getting enough food. Sometimes we may say, don't put any cereal in the bottles, stop giving all those other foods, stop giving all those other drinks. But sometimes they're like, forget all that other stuff. I just want to make sure my child is growing. When they come to see you in clinic, I want to make sure that their weight is getting, growing. You're giving me those positive affirmations. My child is smiling. I want to make sure that they're getting enough food to eat. That becomes the priority over those novel instrumental foods. And sometimes if you think about that with challenges around food insecurity and waste, if I'm getting the same foods over and over again, and I want to make sure the child's eating these same foods, you can imagine how that affects the palate diversity of families that experience food insecurity. And if it limits the palate diversity, imagine how that future will affect their palate as they're growing older and continue to buffer or reduce, attenuate the consumption of a variety of fruits and veggies, whole grains, other foods that we know can be incredibly valuable and improve health. We have an opportunity here early on to intervene. We're not doing enough here, and this is a great opportunity that we can think about when we do these kind of interventions. We also have to understand that the system is not really helping us too much either. Infants naturally accept sweet and salty flavors. We all are born with a natural predilection, desire for these flavors. So when you look at the data, what do we see? When you look at the data and you see grocery stores across the country, when they studied over 500 different vegetable-containing products, what did we notice? Less than 10% of these vegetable-containing products are vegetable only or vegetable first. What do I mean by that? These foods that are incorporating veggies, their flavors are covered by fruits, oftentimes. What does that mean? Well, so we're getting kids to enjoy what they already enjoy. Why not diversify the palate? Some would say, well, we're giving kids what they want. We're giving families what they want. When you give these foods, the child smiles, the parent gives it again. Well, we understand that with the palate of young children, sometimes it takes multiple tries. Even if they make a face, they're probably going to come right back to it. Don't say, oh, it's because I don't like broccoli. That's why my child didn't like that flavor either. But you got to keep giving it. But it's really a hard message if we're not delivering it in the right way. And also, if our systems are not encouraging variety of flavors as well, we can understand how that would influence the behavior of our families. So the question I ask is this: could food as medicine be used as an intervention to support the health of young children in the first 1,000 days? Could food as medicine be used in this population? Something we probably don't explore as much, but something we really wanted to think about more. So we looked at this food as medicine pyramid, and we said, let's focus on produce prescription programs in particular, so we can diversify the palate and really help families diversify and create more adventurous eaters that could optimize the health of children and families. So we created an initiative under our FLIP umbrella. One of the initiatives that we have under FLIP is FLIP RX. It's our produce prescription initiative. This program is for families that are experiencing food insecurity, at risk for food insecurity, and other diet-related chronic diseases, and are less than the age of 5 with this initial intervention, the majority of them being less than 3. This was an intervention that we did, we tried out, we tested, got some seed funding from No Kid Hungry to really get this program off the ground, which we were really grateful for. We started our intervention providing produce from local farmers, really trying to highlight our Black and brown farmers in our local community as well, every other week for 12 months. That was our initial intervention. We coupled this with nutrition education, where we sent videos to our families that we created with videos from families, local families, and we provided that education to our families, in addition with providing a once-a-month virtual cooking class for our families as well. We noticed a variety of things that occurred as a result of this program. So some of this is unpublished, and we'll share that here. In general, we saw an increase in fruit and vegetable intake. But one of the things that I thought was powerful is what happened as a result of this intervention. Here's one family. They said this: I mean, for the new ones or the new produce, there was no better situation for me to use them. I didn't have to necessarily pay for them. And if we didn't like them, we know that we never have to buy them again. Or if we did like them, hey, we just sampled this food for free. And now we know that we can add this into our repertoire. It allowed me to see what my son does like and what he doesn't without me spending money on buying these foods. Another quote: sometimes you're afraid to try new things because it's like, if I buy this and no one likes it, is my money going to waste? We've talked about that earlier as well. A few more quotes for you. We are so used to eating only certain fruits and veggies. Again, limited variety. Now we have a variety of fruits and veggies that we can eat now. So it has broadened our horizons around these foods. Some of the produce I really didn't think my son would like, but once I made them, he liked them. So if he likes it, I'll keep making it. You'll see this strategy happening where the child starts to consume different foods, and then the parent starts to change the purchasing habits as well. When we're going to the grocery store, my daughter, goes straight to the produce aisle and gets our vegetables. There is a transformed interest in this work that may be occurring with these kind of interventions. I said it like this: produce prescription programs may play a beneficial role in increasing diet diversity and quality in families experiencing food insecurity and diet-related chronic diseases. What do I mean by that? I think one of the things that produce prescription programs allows us to do is it creates a lab, an environment in which families can test and taste foods without having the anxiety, the fear, the worry of waste. They test and taste foods multiple times, and you know what? They start to adapt to the taste of those foods. And then guess what? It starts to change their purchasing habits as well. These are opportunities that then may affect the whole family as we scale these kind of programs up. This is just one of the findings that we had with our interesting program, but there's so much more here that we can dive into. Now, what do we know with the White House Summit? There was over $8 billion in commitments that were made. These are powerful commitments that were made across the board. And a lot of these commitments were made towards Pillar 2 agenda items. And if you think about some of those agenda items, I want to highlight some of those right now. the ACGME, which is the accreditation body for graduate medical education in medical schools, right? So residency and fellowships in particular. They hosted their first ever summit on medical education and nutrition, bringing together experts from around the country to figure out what are ways that we can actually move this agenda forward. You can see here pictures from this amazing conference. I had a chance to talk about the cultural and structural aspects of nutrition and really making sure that we don't forget about that when we provide nutrition education. I'm here with Dr. Angela Odoms-Young as well. Here's me with here's one of my colleagues, Dr. Jacqueline Albin, out of UT Southwestern, doing great work in culinary medicine. It was an amazing opportunity to bring some amazing faces together, to learn from, to bring some voice to this conversation, and to help to move this agenda forward. We also talked a lot about culinary medicine. Here's me with some of my culinary medicine students, teaching about the power of food and nutrition through experiential learning. If you think about food and nutrition learning, you can think about getting taught through a didactic session where you have a teacher and you have students, top-down kind of approach, which can be quite effective. But the opportunity for experiential learning is quite powerful as well, where we get students, faculty, residents, community members in the kitchen spaces, and they're cooking and learning together. They're learning the power of food, not just nutrition, right? Because oftentimes families want to hear about food and don't want to hear about the details of nutrition. So this gives us a powerful opportunity. We talked a lot about this being a viable option to train providers as well. We talked a lot about, or we didn't talk a lot, but this is another intervention that was done through No Kid Hungry. American Academy of Pediatrics, they teamed up together, promising to train over 67,000 AAP pediatricians on both how to screen for nutrition security and how to intervene to address this more effectively. Again, building off of Pillar 2's recommendations. The last one I want to highlight is some of the work that our team was able to work with PHA, Partnership for Healthier America. We created clinician handouts to help address this topic, food and nutrition security, and providing early education in these first 1,000 days for our providers. Really take some of that burden off of them. And I want to highlight this again. I want to emphasize this, but I want to make sure this is not missed. We don't want our providers, or as in the clinicians, physicians at that, to be dietitians. Dietitians are doing a phenomenal job. You know, we encourage that. We want to continue to refer to dietitians, but there are a lot of issues that are going to come up in our clinical spaces where we're not going to be able to refer to a dietitian. We don't have a dietitian available, and we need to provide instant, sort of direct, strategic advice and guidance, and we need to have that awareness. In addition, as one of my colleagues says, we want to make sure that we are doing no harm, because a lot of what we've done in the past is provide a lot of harm around food and nutrition, not recognizing a lot of what we talked about before. So we want to do this in a way that does no harm. So it's important that we do this work effectively, and this is a tool that we use to really support providers all around the country. Here's some of that toolkit here. You can see 7 guides that go from pregnancy or from conception all the way to 24 months of age, providing information in English and in Spanish. We've done a sensitivity review. We did focus groups. We did multidisciplinary teams to get insights from different people as well. Here are the guides that you can see here, really, again, going from that conception state all the way to the age of 2. We provide safety guides, thinking about providing or feeding sort of foods that are hyperallergenic. How do we sort of do this in a way that reduces allergy as well, right? There's all kinds of meat in this as well that providers are now using quite commonly, and it's a great tool that brought together the Dr. Young Project out of Spotsylvania, Virginia, and Partnership for Healthier America. I'll end with this slide. We have great momentum that we built, and we can continue to build great momentum. The time is now, the season is here for us to dive deeper into this topic. Pillar 2 has given us the framework in a lot of ways to be able to build off of some really powerful opportunities to use food as medicine, to address food insecurity, and more importantly as well, to diversify the nutrition education workforce. I want to thank you all for your time today, and I think I have a few minutes for a question.
Thank you so much for your presentation. It was great. And I do have some questions from the audience that I want to go ahead and feed to you. So one of the questions was about the terminology, food as medicine. And since you are a pediatrician, do you use the term food as medicine with children and adolescents, or do you use a some different verbiage that might be more, I don't know, appropriate for that audience?
Yeah, I think food is medicine is a great term for our research, for our strategy, for our public health agendas, for our missions. I would never, I don't say never, but I would rarely use food as medicine as a term that I use with patients and families. If I don't use it as a term, but I would describe food being a powerful tool to improve our health and could serve similar to being like a medicine for us. So I do want families to recognize that food has great power in the health of in our health. And I think it's oftentimes not given the chance it deserves. We as healthcare don't give it the chance it deserves, and not as a result, but in addition, the systems that our patients' families are in oftentimes don't recognize food and nutrition as being, or it confuses food and nutrition for patients and families. So they don't really, oftentimes there's a lot of confusion about what we should go to, where we should go, how we should eat, the different kinds of food we should eat. Is this food ultra processed or not? But it says it had vitamin C in it. So isn't this better? So there's just so much confusion around it, and we have to provide more clarity. Not just us, systems, public health, all of us as a cohort need to really support families in that.
Awesome. And there were a lot of questions and not questions, but a lot of comments about the RX program you were discussing. A lot of people loved it. And there was a question kind of about sustainability. So say you're providing a produce prescription program for 12 months. What happens when families, participants are no longer a part of the program? What can we do to maintain those behaviors and those the lifestyle modifications that they've learned?
That's such a great question. And I think we're all trying to learn and figure this out together. I think there's a variety of aspects here. For us, what we did, and I didn't mention this, is that we've trained navigators, patient navigators, to receive referrals from families or from physicians or other team members, community health workers, social workers, any other team members. These patient navigators do a few things. They, one, identify what challenges families have and connect them to meaningful community resources, local resources, but also federal resources, right? SNAP and WIC. We know there's a huge drop off in WIC after age 1. We know with cash value benefits itself, WIC can serve as sort of a produce prescription program. There's so much benefit with these federal nutrition programs that we want to support families on that can really provide families with added support over the course of that year. Again, on average, most families experience food insecurity about 7 months out of that year, and these federal nutrition programs can provide more of that longitudinal support in times of hardship for families. So we think that that's an important aspect to this, undergirding these programs with some of these stronger federal resources as needed and beneficial. In addition, what we hope to do is we're giving families tips and strategies to then be able to transform the purchasing power. So the foods that they're purchasing, how you double up your bucks with SNAP, how do you use your food and stretch your dollars, how do you store the produce better and the different items like that better as well. So hopefully some of those tips are important as well. We don't prioritize that as central because I don't think the first strategy to address food insecurity needs to be, this is how you save, you spread out your money, right? When you look at SNAP spending, for example, I'm sorry, I'm rambling a bit, but I got a little time, so let me throw this in here. When you look at SNAP spending in particular, when you look at older data, you can see that by day seven, you receive all your benefits on the benefit card. By day 7, you see about 60% of spending being completed by day 7. By day 14, 2 weeks in, you see 80% or more of spending being completed. You have 20% spent or left for that last 2 weeks. So you're going to do a variety of different things. I'm going to see how I can stretch it. You can see hospitalization rates increase. You can see adult caloric intake decreasing. All kinds of things happen at the end of that month. So we want to make sure we're thinking about strategies that can optimize and provide and advocate for policy that's securing and strengthening SNAP spending or SNAP dollars. And we recently went up October of 2021 to about $1.80 per person per meal, which should help. There's different things that we're doing. We want to keep advocating to provide adequate resources to families to be able to support their own nutrition security as well.
Yeah, I love that. I love that you're using a systems approach. It's not just putting all the burden on participants to make a change, but looking at policies, the environment, and everything. And you touched on the community navigators. One audience member asked, what food insecurity screening tools did you use in some of these interventions? And were the community navigators the ones maybe screening for food insecurity or somewhere else along the process?
Great question. So as you remember, universally, we started screening for food insecurity in all of our primary care clinical spaces in 2016. The screener we use is a 2-question hunger vital sign screener. That is one of the most dynamic, easy to incorporate tools to determine if a family is at risk for food insecurity. I would encourage those who are using the screening tool to not use the yes or no dichotomous variable. That dichotomous variable will miss about 20 to 30% of positive or affirmative responses. I would encourage you to use the often true, sometimes true, never true, or refuse to answer, don't know answer, because that will increase response rate and comfort for families so they don't have to kind of pick a side. There's a lot of anxiety around these kind of questions, and families will oftentimes pick that sometimes true category, which tells you nothing about severity, because the 2-question screener doesn't tell you about severity. It just tells you about at-risk status. When the family is recruited into the program and onboarded, one of the surveys that we do is a more extensive 6-item USDA survey, the short form. So that short form gives us the opportunity to determine severity of food insecurity. That gives us a chance to determine marginal food security, which in itself, not considered technically food insecurity, but it itself is associated with disease outcomes. We look at low food security and very low food security. And one of the things that we often see with these kind of programs is it shifts families from very low to lower rates or off of food insecurity to marginal or no food security. So I think that's also another powerful thing that we see. I was really interested in looking at the 18-item tool, but it just adds a lot of survey fatigue. So we try not to use that. So again, that's the tool that we use in our clinical spaces. But there's so many ways of incorporating the We Can tool, Prepare. A lot of them use the 2-item tool or use one of the questions from it. I think at the end of the day, the questions are great, but I think more importantly, practically, we need to also add a question in there, just asking them, do they want resources? Because at the end of the day, a family may choose to not answer, and that's okay. We shouldn't have to burden our system or burden our family on having to elicit this response for them to get the support that they're looking for. And also families may say that they have food security, but these benefits may still be quite effective. And also, the specificity and sensitivity of the screening tool is great, but it's not going to catch everybody. So these are just things to think about if you all are implementing these in your own settings as well.
Wow, that's awesome. The questions are rolling in. People are really engaged in this topic. So one audience member was asking, I guess, when you look at disparities and inequities in food insecurity, they were asking about the prevalence among American Indians. They did not see that on the slide. And I am hoping that I'm reading this right, because I also see reservations. So when I say American Indians, we're talking about Native Indigenous people to the U.S. So can you speak to that? And maybe that wasn't what your study was actually looking at, like that specific group of people.
Yeah, thank you for that point. Some of the data doesn't tease that out, but when you look at the data that does tease that out, we see that the American Indian, Alaskan Native population has some of the highest rates of food insecurity. Some of the highest rates, 1 or 2, right? Highest rates, 2 or 3 times higher than majority population, right? So that's a quite positive group. And also when you look at rural settings, American Indian rural settings, there's a lot of challenges around accessing food, but not only accessing food, right? There are grocery stores, but it may not be the store that you want to access. So sometimes there's increased burden about getting to the grocery store that gives you that food sovereignty, right?
Yeah.
Purchasing foods that are meaningful to your culture, to what you eat, to what means life to you. So there's a lot of challenges around that as well. But in general, that population has very high rates of food insecurity.
Yeah, thank you. And another audience member, they were questioning about medically tailored meals. So they said, that you discussed those earlier, but have you done any work about medically tailored meals for children with special healthcare needs? So maybe like developmental needs or even inborn errors of metabolism or anything like that, or yeah.
So I personally haven't done any work, and I can't now think of any literature that's coming to mind that's done that. I know that a lot of the medically tailored meals organizations, I work with one in DC called Food and Friends. There's one in New York called God's Love We Deliver. Really powerful organization doing phenomenal work. They oftentimes are focused on adult conditions A1C risk factor high, this high, certain conditions. There are oftentimes a few for pediatric settings that they try pilots around. Oftentimes these aren't as well funded, but like with cystic fibrosis or certain conditions, there are different interventions that they use around that. I think that is a very viable population. If somebody is thinking about that, let's get it, let's go, let's do it, let's test it, let's see how effective it is. We know that these interventions can be quite effective. Food itself is a great tool for increasing health. Let's try it out. I haven't seen a lot of the data around that though.
Well, sounds like a good research gap. So we might have some students on here. That's maybe a dissertation or thesis topic. So that's great. I know we're down to 2 minutes, and before I check for any more questions, I wanted to see if you had a take-home message you wanted to give the audience, or a call to action, or just a nugget that you wanted to leave on the top of people's head. So.
Yeah, let's do it. Food is not the answer to food insecurity. Food is but one of the approaches we can use to addressing food insecurity. To address food insecurity effectively, to address these conditions that we're talking about effectively, it's going to require systems change. We have to think about systems. That's going to be an important piece of it. We have to use our voices, every one of us on this phone, whether you have your own lived experiences with food insecurity, professors who have had their own lived experiences, whoever you are on this phone, and I say phone, I mean Zoom, let's think about how we can use our voices, or advocate to bring the voices of those who we work with to the table to really influence change. Take away some, there's so many restrictions around some of these programs around, racist policy agendas that limit people from access. There's just so much stuff that we can do here that I think is going to require us to go upstream and do this in a way that's more effective. Child tax credits, federal programs, thinking about how we can support families in a more meaningful way as well, and equipping them to live the life that they're trying to live.
I love that. So thinking more in upstream solutions, systems minded. So I think that's something we can all work on and apply to the works wherever we're at in our communities. So thank you so much, Dr. Essel. We have some more questions that we didn't have time to answer, but I'll be sharing the questions with all the speakers. So if y'all have time, they'll be able to look at your resources and your organizations too. Thank you again.
Thank you all for having me. Have a great day.
Bye.
All right. Good afternoon, everyone. So we are off for our next panel discussion, which will be emphasizing Pillar 3 of empower all consumers to make and have access to healthy choices. So I'm going to ask our panelists to please put on your cameras. And it's exciting that we have 4 individuals who are going to share very important information of what they're doing in their communities. So the first thing that I'm going to ask is that everyone who's on the panel, first, please introduce yourself and provide the name of your organization and a brief overview of what your organization's mission, vision, and or goals are. And let's start off with Marissa.
Good afternoon, everyone. My name is Marissa Spady. I am a registered dietitian, and I'm the senior field manager for No Kid Hungry Tennessee, and I'm located down in Chattanooga. I work for No Kid Hungry. We are a state campaign of a national nonprofit organization called Share Our Strength, and our goal at No Kid Hungry is to end childhood hunger by way of the federal child nutrition programs. Our hope is to have every child have access to 3 meals a day, 365 days a year. So that's what we're here for. I work closely with the school breakfast and school lunch programs, the CACFP at-risk after-school meals, and the summer meals programs.
All right, thank you. Who would like to go next?
I can go next. Can you guys hear me? Okay. Hey, y'all. I'm Femeika Elliott. I go by Mika. I am the founder of Rooted East Knoxville, which is a food and land justice collective here in Knoxville, Tennessee. I'm also the founder of the Lotus Program Experience, which is a holistic meal service and wellness program for all women. However, we address disparities pertaining to Black women when it comes to maternal health mortality. My goal is to create viable and innovative solutions to the common issues within the Black community, specifically East Knoxville. So I am not only a social worker, but I am a holistic food pathways practitioner, herbalist, community builder, and social issues disruptor. And my job is to educate our community on food apartheid, as this is what Rooted East addresses. Currently, Knoxville, the Black community pertaining to East Knoxville lives 47% below the poverty line, making at or less than $20,000 annually. And so part of our vision is to recreate the food landscape in East Knoxville, as there's been a lot of Black removal or urban renewal, as most folks know it as, i.e. gentrification. And so our goals are self-sufficiency, sustainability, and we also are wanting to create an abundant natural food landscape here in East Knoxville.
Right. Who would like to go next, Courtney or Marco?
I'll go. Can you hear me? Okay, good. I'm Courtney Liles. I'm the Nutrition Access Program Manager at Second Harvest Food Bank in East Tennessee. We are a member of the Feeding America Network, and we work to feed East Tennesseans through feeding programs and over 630 agency partners. And actually, a pretty cool thing, we just got our data from the previous fiscal year, or for 2022, 2023, and we distributed 24 million pounds, which is a record for us across 18 counties in East Tennessee. So that's what we're doing.
Thank you. And Marco?
Yeah, hi everybody. My name's Marco Lemus. I'm the Food is Medicine Project Manager at Urban Tilth. We're based in Richmond, California, and our organization hires and trains local residents to cultivate agriculture, feed our community, and restore relationships to land to build a more sustainable food system. We have a 3-acre farm, community gardens, school gardens. We distribute to the farm to table CSA. We have a watershed creek restoration, program. And yeah, I think that's pretty much it.
Well, thank you. So we're going to work our way backwards. We're going to start with Marco, then go to Courtney, then Mika, and then Marissa. So my next question for you is briefly describe the resources you work with or have in your position that help improve food access, which I think all of you did in a little bit in your introduction, but if you can expand some more on that.
Yeah, so there's a bunch of different ways that we, the resources that we use. Our work wouldn't be possible without the volunteers that have came through and supported our programs throughout the years. Today's actually our 18-year anniversary too. So that's like crazy to think about. And a lot of we create partnerships with a lot of different organizations. My job was created, or my position was created to develop this collaboration we have with the clinic called Lifelong Clinic here in Richmond. And I essentially talked with the doctors and their resident doctors. Essentially, they spend a month at Urban Tilth learning about our programs. And then at the end, they put on a certain project like a cooking demo for the staff or for the community. And so, yeah, and like our other partner orgs, we have like a coalition made up of 9 other orgs in Richmond that we, have regular meetings to talk about the different organizing around different issues and how to move forward with certain issues that come up. Yeah, and our local residents too are like our biggest resource, I think, because they're the ones that really guide our work. And we're always trying to get their input when it comes to future plans that we have and making sure that their voices are heard and included in the blueprints essentially for what we're creating in the near future. So yeah, I'll keep it short like that.
So at Second Harvest, we also rely on our volunteers and also like donors and grants and things like that, as far as like funding our food and getting food out to our community partners. But we kind of are a resource in the community, as far as like we partner and support other agencies that aim to distribute food. So as I said earlier, we have over 630 agency partners, and those include, you know, anything from faith-based organizations to even medical facilities. We have some relationships with the hospital, UT Medical Center. We're currently with their cystic fibrosis clinic and their heart failure clinic. We help provide medically relevant food boxes for the people who screen as food insecure. And then we also are partners with Food for Kids. We have a Food for Kid program, which is kind of like a backpack program, if you guys have heard of those programs before. So we're in all this, like 240 schools maybe across East Tennessee, where we're providing food over the weekend for these kids who may not have access to food over the weekend. So we're all over the place, really, and but we couldn't do it without these agency partners that are actually on the ground doing the work, knowing their community and what their people want and what they need.
Okay. All right. So I just want to go back and reiterate our mission and vision. So the mission of Rooted East Knoxville, we are committed again to addressing food apartheid by restoring power back to the Black community through self-sufficiency, gardening, food education, and overall wellness. Our vision is to recreate the natural foodscape. We are a movement that is community-led, community-funded. We are an autonomous organization with a 501c3 fiscal sponsor. And we desire to create a thriving, resilient, and equitable Black community through collective partnerships, whether it be collective education, skills training, or holistic well-being. And we do this by allocating community resources. We bring in allies, other abolitionists. We currently are leveraging our existing partnerships. So our core team is made up of 6 grassroots organizers, which we are part of 6 different grassroots organizations, and we have our own separate skill sets that we bring to the core team, but we also have individual networks that do intertwine with our mission and vision of Rooted East Knoxville Collective. So we have partners like United Way that have given us unrestricted funds to, start the initiative. We have Beardsley Farm that help us with gardening education and tools for our gardening core programming. UT Ag Extension and the 4-H Extension, we bring those folks in to come and teach our gardening education. Other members of like the Community Growers Gardening Alliance, we get some of our volunteers from there. They are an alliance of master gardeners as well. So they will come in on the back end when it comes to teaching our community members how to be confident in growing their own food in their backyard or in local community gardens that we are establishing here in East Knoxville. And then we also leverage our existing partnerships with attorneys. So as a social worker, I have leverage within the legal field as well. And so I leverage some of those partnerships as well as city council. But our volunteers are absolutely awesome. And they do, the biggest part, which is by showing up or connecting us and allowing us to be those community bridge builders to help bring and mobilize the resources that our community members are telling us that they need. Oh, and we also do this by providing this program and everything to the East Knoxville community for free. We do not charge for any of these resources that our community members need.
Awesome. I think something you just mentioned was we're bridge builders, and I feel like my role at No Kid Hungry and helping to address childhood food insecurity here in Tennessee has really been a bridge builder. I work closely with the school nutrition directors across the state of Tennessee, as well as the community-based organizations who are sponsors of the Federal Child Nutrition Program. So again, school breakfast and lunch at Department of Education, and work closely with the state agencies as well as Department of Human Services. And with that being said, understanding how things trickle down and understanding what's happening on the ground and being able to share out best practices, not only here in Tennessee, but across the country, as we have a network of No Kid Hungry states across the country, and learning exactly what is happening. I just got in from a summer meal visit from Cumberland County today and saw just an amazing, the heart that goes into these meals for these communities is just amazing. And so our goal at No Kid Hungry is really to lift up those folks who are on the ground and getting meals out to families. And also advocacy. We have a team up in DC who are great advocates for these federal child nutrition programs. So by finding out what's happening on the ground, we can relay these messages and stories back to our lawmakers, and so that they can understand what can be most beneficial to families on the ground. But ways that we typically work to be a resource to our school nutrition programs and our community-based organizations who are providing the meals to families. We often do grants for those organizations. In fact, we just gave out about 17 grants to our summer meal sponsors who are going to be doing the rural non-congregate meal distribution for summer meals this summer. So that was very exciting just here in Tennessee. So I'm real excited for that. We also do webinars to share best practices so that folks can learn. It's no need in reinventing the wheel here. We're on the same team. We all want to end hunger together. So we provide those on a national basis and sometimes locally as well. And then we do a lot of outreach and awareness. I think some of the federal child nutrition programs, people are not aware of all the nuances and regulations that go into families being able to participate in those, and also the sponsors that are hoping to provide those meals. So we try to do some education and outreach. We have a text line during the summer months. So you can text the word food or comida to 304-304 and figure out where the closest summer meal site is to you. So those are some of the ways that we try to be bridge builders within our states and our communities across the country.
Great, thank you. Marissa, would you mind when you have a chance to put that in the chat, the number? Because some of us are a little slow in taking numbers down. So if you could do that, that would be helpful for our audience. So as bridge builders, collaborators in the community, what are some things besides time, money, and people that other communities can do to start this process of improving access to healthy food options in their communities?
Are we answering in order, or is it just anybody?
Whoever wants to jump in.
Well, since I'm on here talking. So as a food educator and pathways practitioner, I've noticed that it's very important to meet people where they are at in their health journey and their health goals. I think oftentimes people aren't relatable. Certain practitioners aren't relatable. They're not of the community that they say that they desire to serve. So it can cause a rift in community trust or acceptance when it comes to being receptive of the information. And it's also not easily digestible, at least for my community. So my job as a food educator is to not only meet people where they're at, but to also put it in layman's terms, how they can understand it. And so I also think that it's important to look like those, or at least send somebody into those communities that you say that you want to work with that are of the community, where people, these community members either know a familiar face or they at least look like that demographic. Oftentimes in our marginalized community, we have other folks that aren't of the community, they don't live in the community, our community members aren't aware, so it causes this rift, and they don't want to communicate with them at all, no matter what the help or whatever it is presented. And so it's oftentimes they'll contact me and say, hey, Meek, do you know this person? And I'll either say yes or no. And so they're relying on me to basically verify the person that's coming to them about some source of help or services. I will also say, I always said, make it plain and digestible and consistent. Research is great. However, speaking with community members that you desire to help, directly asking them of their needs and having a casual conversation and building up on that and establishing rapport has gotten us much further than a paper survey or handing them an iPad or just doing an interview style. Most of our folks that we serve of the community are elders, or they are youth between the ages of, 5 and 17, 18. So, they don't want to do that. And most of the time they are kind of like bribed or incentivized, hey, participate in our survey, you get this gift card. We've never had to do that at all. It's just by means of establishing a trusted way of communication and just real dialogue without trying hard to extract this information that you're needing for your data set and your numbers. And so our community appreciates, the grassroots organizations and the people that have been doing the work to conduct this research and to start these initiatives because of the community trust that was already built. And also don't assume the resources that people need. Ask them, they'll tell you. Don't just assume. They will literally tell you. So yeah, that's all I have.
Yeah, I'll add on to that and just say I love everything that you just said, because that's like a big thing that we try to do at Urban Tilth. And it's why our work becomes so easy, because we do hire so locally, and we do, I don't know, we just have a great, every new person always contributes to the whole vision. And it's great to know, like, I'm always meeting people who, because Richmond is a small city, so I'm always meeting people who knows my cousin or a friend or something like that. So, and like, I don't know if people know how this feels, but it's like so rare that, like, especially BIPOC people have that, poor BIPOC people have opportunity to talk to others like them and to feel empowered enough to have a voice in big decisions that are being made in our city. Because in the past hundreds of years, even like you could make the argument that like we haven't had our voices heard. And so, yeah, it's just about like, I don't know if that answers your question, but because, people, I think it definitely is a powerful resource, but, I don't think you need money to like talk to people. And so like, yeah, just trying to make sure that people who aren't normally at the table feel like they're actually being heard. Because I think sometimes we, BIPOC people, they do get invited to these decision-making tables, but they don't feel comfortable enough to speak up because it's a majority of people they don't grow up with or like have the same manner of, conversating or priorities or, culture. So I think that's definitely something that I think people can try to incorporate.
I actually really loved this question because I've been doing a lot of personal and professional research on kind of this area and what food insecurity actually looks like at a large scale, since it's pretty important for me to see as somebody who works in nutrition in the charitable food system. And while I definitely think that it's important to, empower and improve access to healthy foods within communities, like how the community can come together, and really promote that, I actually think this issue is more twofold than anything, because I don't think that at a large scale, we need to rely on communities, individual communities, to have to take care of each other in addressing food insecurity. While I recognize that community literally means like, coming together, I think that putting the burden of food insecurity and access to healthy foods on the community is inequitable and very unfair. So I think that while, as a food bank in the charitable food system, where we do reach out to so many different counties and are partnered with so many different types of organizations, and we have a very diverse population in the East Tennessee, much more than honestly I knew before I joined Second Harvest. It's really important to partner with those organizations, meet the needs right there, empower them to serve their communities, but also look at policy at those levels, in the local policy and state policy and federal policy, to make changes to the underlying causes of food insecurity, and like equitable pay and housing and all these things that ultimately highly influence food insecurity and what we do. And so I always say at the food bank that I think a lot of my coworkers would agree that I would love to not have a job anymore at Second Harvest, because all these the policy is set in place where communities are self-sustainable and they have all the resources they need to take care of each other, but that it's not because we as a system rely on those communities to take care of each other. They are resourced to do so. So that's something that I'm kind of, as a personal and professional project, trying to really make sure as a charitable food, as part of the charitable food system, to help out with.
And we're talking about the resources, just to make sure, as far as resources that we've seen and being able to support our organization, I would say what you all kind of have already mentioned, it comes down to relationships, I think, and whether it is helping the relationships with the families and the children that you're serving, and the relationships with the partners and the folks in the community that you want to be supporting, and working together and finding a common ground to figure out, how can we all work together? I had the example this morning being at the school system, and they had partnered with the food bank, and so they were doing their part and continuing to serve meals to the students, but also had found a partner who, in the food bank, being able to provide additional resources for the whole family once a month through their food box. So I think understanding what it is the need is, and then being able to follow through. And I think follow through is a huge piece to understanding and improving the lives of those in our community. So I think you all already summed it up very well, so I won't go any further.
So I am actually going to jump to a question that came from one of the audience members. And it really refers to that oxymoron of empowering in the third pillar of the third pillar of the White House Conference on Hunger, Nutrition, and Health. Because the audience member says, what do the panelists think about empowering? To me, if families don't have access to reliable funding, transportation, food, healthcare, what can we do? What can we do to empower them? And the person mentions that obviously you didn't write the third pillar, but just wondering what your thoughts are about that word empowering. Perhaps how would you rewrite it, or what does empower mean to you, given that you are empowering community members, but it may not necessarily be in what others consider to be empowerment?
I think it depends on who's using the term empowering and how you're using it. Oftentimes, I know us in the Rooted East Collective and those that volunteer with us, or community members that are in our program, they know that one of our, part of our mission is to restore power back that has been taken away. So not necessarily using the term empower, but I know personally using the phrase restoring power as far as giving the community members back their power by way of food systems and equitable actions that they feel empowered, and I don't even have to say it. Like, it's like this understanding, this mutual understanding that, okay, these folks are mobilizing all of our resources. So yes, we may not, collectively, they may not have the funding. However, we receive the funding to ensure that they get everything that they need. So we're not only mobilizing gardening education, but we're mobilizing nutrition and food education that's digestible to them. We're mobilizing other skill building assets like, wound care, gun safety, like all the things to where they don't have to rely on outside forces or go outside of it, because most of our community members travel by foot or ride share. It's very, very complicated when you're working in marginalized communities, specifically the Black community, because everybody thinks that it's like this one size fits all solution, but it's not. I think of it as like a dinner table with 4 legs. And it's very complex, but yet simple. So yes, we have food here, but we also have Black equity, and we also have transportation issues, and we also have social determinants of health. Like, it's like this big ball of everything that contributes to our health and tons of other things within the community. So I don't really use the term empowering. I always say restoring, recreating, building, more positive things. And like I said, I do believe that it depends on who is using the term empowering.
I think with some of the, first of all, I love this question as well. So thank you, Diane, for asking it. In my research as well, some of the things as far as empowering goes, we historically the charitable food system has had a reputation of kind of taking away some of that power, because it was actually established as kind of a place where excess food was given, so that way it didn't go to waste. And so people who were recipients of the system were already kind of set up as like not being treated as well as they should have been, and kind of with dignity. And so as the food system as the charitable food system has kind of progressed, and we are kind of rebranding, I would say, as a whole, on trying to provide a client choice model, so that way people are able to choose their foods rather than like I've been told stories from my boss, who's worked at the Second Harvest longer than I have, that we would try to give away on mobile distributions like 10-pound bags of popcorn kernels, because that was what was donated to us, and we weren't in a position to be able to purchase extra nutritious foods and things like that. And so I don't know, besides a movie theater, who's going to want a 10-pound bag of popcorn kernels, but now we're in a position to where we can purchase nutritious foods. We can make them available to our pantries, which actually our purchasing powers is good, so that way our pantries are able to purchase food from us at a discounted cost, so they can use their funding elsewhere. In addition, we also have our produce is free of charge to our pantries. So we encourage a client choice model at these pantries, so people who are already kind of limited in what they are able to choose, we have lots of options, so that way they can choose them. We try to offer more options. Now we also try to, encourage people to sign up for SNAP and other government assistance programs, so that way they can actually, like, even more so take that money and go to a grocery store and have even not unlimited, but almost unlimited client choice options. So that's kind of how we try to empower populations, though I would argue, or I agree that empowering is a challenging word when people have limited resources because of a larger issue with the overall system.
I just wanted to share briefly, I agree with both of you. We just did, as an organization, we're in the middle of kind of rebranding, reorganizing as well, and really focusing on equity and diversity and inclusion for all. And the word empowering, we did a asset-based framing to be able to tell the story of those that are being supported and are in their lived experience, and the word empowered did come up, and we felt like if the word empower is there, that was the fact that someone had power over someone else, and how do we remove that word? And so I really liked the way you utilized restoring power or mobilizing or building. That sounds much more positive, and I think ensuring that our team is better skilled at making sure that we on our side don't tell the wrong story and don't assume anything from anyone else about anyone else's life is something that we hope to be able to do better at, and I think we're all trying to do better. And so that was something that kind of came to mind as we were having the conversation.
Yeah, I'll keep my answer brief, but my mind's going everywhere with this answer. But yeah, I agree that I don't think people can be empowered if they don't have reliable funding, transportation, food, healthcare. Like health outcomes is directly impacted by systemic, influences, and it's why we like to distribute straight to people's homes, because if transportation's an issue, like we try to deliver where we can. We try to post up our free farm stands at community events. Yesterday, we just had a farm stand at a soccer field where people gather, and had doctors. They did like a walk with the doctor around the track where people were able to talk to a doctor, and they had Zumba class. So it's like a bunch of different things, and I think it is like a matter, because if this is Biden, the idea of empowerment coming from the Biden administration, and that means that like if we pass X, Y, and Z programs, and now they can say that people are empowered, and like we know that's usually not the case when the national government is telling people like, yeah, they're free or they're healthy, and it's like, well, we need to ask the people, like, do they feel empowered? And I think that goes back to what Mika was saying about who is the person saying, are they empowered or not? And yeah.
Thank you. So all of you truly spoke about the importance of collaborations between local organizations to really increase the reach and impact of local efforts. Could you provide an example of a community collaboration that you did in your community that was successful?
Okay, I'll go first. So we believe in collaboration. First of all, we are a collective, which means that we have initiated collaboration by collaborating with each other to form this collective. Everybody that is a volunteer, or whether you are a workshop instructor, is a collaborator. And we also partner with grassroots organizations outside of East Knoxville, but also the Black-led grassroots organizations, along with nonprofits like United Way, Our partners there were the first organization to donate us unrestricted seed capital to allow us to serve our community. Also, being in the Black community here in Knoxville, it can be sometimes hard when other Black organizations are addressing other issues of the community, and based off like conflicting time schedules. Sometimes we have to, allocate resources outside of our community just because the need, like we have tons of needs in our community. So changing the status of collaboration over competition is very important to us, because we notice that we all have a variety of skill sets that our community needs, along with our network reach, to better our community. So yeah, I just feel like when everybody collaborates for the betterment and has integrity in their work, and that community trusts them, it goes a really long way.
One of the collaborations that Second Harvest has, it's actually with Chris Battle with Battlefield Farms, who is part of Rooted East with Mika. He kind of already had an established partnership with Nourish Knoxville, which is our farmers market kind of initiative in the area. And so Second Harvest will, we actually purchase food from the farmers that it's not the leftover, but the stuff that the farmers have. I guess it is leftovers, but they're not bad leftovers. It's the leftovers that are from the farmers at the end of the market. And we are able to purchase those for the veggie van, and Chris Battle will take those foods to his community in East Knoxville. Second Harvest also does supplement a little bit with some produce for him as well. So that's kind of a collaboration among 3 organizations there with Nourish Knox, Second Harvest, and Battlefield Farms.
I'm just going to share one that just happened recently. Last week, I was doing presentation at the Tennessee School Nutrition Association conference in Gatlinburg, and wanted to go by and visit one of our Boys and Girls Clubs that is in the Smoky Mountains. And as I was visiting with them and they were sharing, understanding the food program, you can only offer 2 snacks or 2 meals a day. And so some of the children at the Boys and Girls Club stay a very long time, and only 2 meals a day is not really enough. And so as I was leaving the visit, going to this the conference, the Boys and Girls Club asked if there was any way that if there were any leftover food items that could be brought, that they could collect. And in fact, we reached out to the folks who were putting on the conference, and sure enough, we were able to help send home 2 truckload full of food back to the Boys and Girls Club to be able to help support additional food that the families may need or extend the day while the kids are there. So that's just one example, but we've also been able to connect, a Boys and Girls Club in Middle Tennessee with a food bank there who's now going to be bringing in suppers for the kids, or the school system that didn't have a supper program, and now, like I said, the food bank is going to be sponsoring them. So just increasing access to those meals and making the right connections that maybe folks didn't realize were available, and offering that as a resource.
Yeah, I'll say that, and as I mentioned yesterday, we had an event that was, we call it Thriving Thursdays, which will be every Thursday during the summer. And it'll have like different organizations coming to give out resources. They had Rich City Rides, who's a bike shop, Zumba class, lifelong doctors telling them about the importance of exercise, First 5 that gives out parenting resources. And the the county supervisor office has been super helpful since the beginning. Like they're the reason why we were able to purchase the community farm that we have, rather than sell it to a developer who's trying to profit off and like take up all the land in North Richmond and, you know, just turn it into a commercial industrial kind of area where people live and, you know, right next to an elementary school. So I'll answer the question by saying, I think successful partnerships with other community orgs is you determine that by how continuous it is and making sure that it's consistent, because there's been plenty of times where, you know, organizations come together and they put something on and all the residents are wondering like, when is this going to happen again? This was so great. It's like, sorry, like, you know, funding issue or this issue, that issue, and this will be the last one pretty much. And so I really like to see that, like, I'm actually not just creating partnerships, but friendships with people who are very like-minded and have the same passion towards their work and healing Richmond, who has a lot of like hurt and trauma and, you know, all that stuff. So yeah, I just want to focus on that idea, that making sure that it's a continuous partnership and that we don't come up with like reasons to end it. It's not a perfect process either, you know. There's like definitely some ugly moments that happen because this is a very personal thing for all of us, and you know, just making sure that we're prioritizing the work, but we're also prioritizing our own health too, you know, that kind of thing. So just being on the same page with other community orgs is a big factor, I'd say.
Femeika, you wanted to add?
Yes, I wanted to uplift Courtney's mentioning of one of our co-founders, Chris Battle. I wanted to kind of give like a backstory. So that was our first collaboration. That's why we formed Rootedies. So myself being a food educator and a food pathways practitioner, Chris actually needed help with the Fannie Lou Veggie Van and the disbursement of, I guess, the routes in the community, but also he needed somebody that could go out with him with disbursement and educate community members on the types of produce as far as the benefits and how to prepare them in the multitude of ways. And so we came together to form Rootedies, and then we went and found other grassroots organizers and members of the community or that have already been in the community with us that intersected and aligned with our vision. So thank you, Courtney, for mentioning that. I have to give credit to my co-founder, Chris Battle, as well.
Awesome. And I think the other thing that we need to think about too is changing the perception of leftover, because there were once a time with many of our ancestors who used all the food for everyone, and every piece was special and precious, and it continued for sustaining life. And so we need to take that negative connotation from leftover away and start seeing as, hey, this is just something else that we can continue to use. So one other question, how can maternal and child health professionals help improve the food system and increase economic development in historically marginalized communities? So what advice do you have for those in the audience to really help improve the food system and to impact the economic development?
Oh, well, I'll go first. Because so I'm the founder of the Lotus program, which initially started as a postpartum meal delivery wellness program for moms post-birth loss and grief. However, we have expanded full spectrum. I'm not sure if those that are on this call know, but Black women suffer from postpartum depression and distress 4 times more likely than any other demographic. And a lot of that comes down to socioeconomic factors, stress, but also nutrition and by ways of food pathways. And so as a food educator, obviously research, but also placing the pressure on other practitioners, whether you're in the holistic birth and maternal space, but also whether you're in the industrialized medical complex or whatever you're in. A lot of the times, we have Black women, are dying at alarming rates. We just saw it with Tori Bowie, an Olympic gold medalist athlete. Literally, it may be triggering to some, but I've experienced postpartum as well, but just her doctor not catching, any signs of eclampsia or preeclampsia. So, and I feel like, yes, she was healthy, but did her doctor teach her the warning signs? Did her doctor tell her what to look out for? Did her doctor educate her family? Did her doctor, pair her with community birth workers, to kind of help alleviate any type of stress or whatever she was having? So I feel like doing more outreach and placing the emphasis on doctors and medical professionals to know who is doing the grassroots works. Prior to the medical industry, as far as the industrialized medical industry and institutions, it was a very holistic practice. And we had community builders, and we had community nurse, granny midwives in the community operating for community. And it was a trust there. And so, when you're working with historically marginalized communities, trust is a big factor. But I feel like sending community peers that look like that demographic into the communities to educate them on these topics, but also, placing the emphasis and the pressure on these doctors. Hey, the granny midwives are here. Hey, the holistic food pathways practitioners here. Yes, we have RDs. Yes, we have nutritionists. But at the same time, are they being racially cognizant? Are they educating themselves on the Black maternal health disparities, infant mortalities, but also the Black eating regimen and historical archetypes? Because, Dr. Spence knows we've had this conversation twice before that, the curriculum sometimes that nutritionists and registered dietitians go through, it's not cognizant or relevant enough to have that conversation with somebody of melanin descent when we talk about the African or Hispanic diaspora. I can't come to my community member and talk to them about Swiss chard. They're not going to know what I'm talking about 9 times out of 10. So I have to make it very digestible and educate them on the who, what, when, why, how it's going to benefit them. So in reference to maternal health, this is a collaborative effort. I don't think it's a one size fits all. Doulas can solve this issue. I feel like it's collective. So birth workers, food practitioners, regenerative medicine folks, all need to come together for the betterment of maternal health, specifically Black maternal health and wellness.
I think it's really important for healthcare professionals to like basically echoing what Femeika said, and then also like being able to refer people to services like WIC in places that we know in food pantries and things like that, as a sort of band-aid for the issues there that are food related. But then on a larger scale, as I kind of mentioned before, really being present and advocating for better healthcare for these marginalized communities and for paid maternal and paternal leave and better wages and equitable housing, and like all the underlying issues of that we know feed into having negative health outcomes, addressing these social determinants of health. And I've actually experienced in my own profession that sometimes it's like, well, why would dietetics need to be, involved in equal pay? Well, because it's actually absolutely relevant. Like all of this stuff, I've heard a lot of things of like being in your lane and stuff. And while I'm definitely not going to tackle over into somebody else's their area of expertise, something about me being able to elevate those voices and being able to be like, yeah, we're going to refer to these things. And so like the healthcare professionals really relying on people who are professional or having these lived experiences to make change within communities and at larger scales as well.
I wanted to say the same thing about making sure that health professionals are aware of the resources that are available to them, to their clients and their patients. I just started adjunct professoring at UTC as a community nutrition course and had different variety of students with different backgrounds, but the large majority of their course was going out into the community to volunteer and better understand what the resources are in their community, so that when they are, no matter what background or career that they take on, that they're aware of the resources in their community that they may be serving, whether it be the food bank or the food pantry or the soup kitchen or the after school meal program that's available to the kids, or the backpack programs. Like I don't know, if they're coming into a new community, a lot of those are the same, but you just have to figure out who those partners are and get to know them and build relationships with them. So that was definitely one. But I will say, as a dietitian, and I had worked in community nutrition for quite some time, I never did grasp what the summer food service program was or how it worked. And so for someone who should have known and should have been educated on that, I did not. And yet, if we're expecting our families who could benefit from this program to be able to take advantage of it, if we aren't able to explain it and have a good knowledge of it, then we're not doing them a good service, or the community a good service, by not being aware of what the resources are. So just my experience.
Yeah, I think it's a complex issue, and one of the small ways that we try to tackle that is by just getting involved with the children and I think that's a big thing, is getting children involved with the cooking process, because a lot of the times that I noticed, kids usually have this preconception of like what vegetables are, and they already don't want it. They want the fruit and the candy. But in reality, it's the vegetables that they're being exposed to. And so I'd say, doctors should really get involved in like advocating for better school lunches, because kids are really open-minded and they love cooking and they love vegetables in reality, and let them determine how they want to use it. And it kind of goes back to the idea of empowering. But yeah, just bring them to the table. And I think it definitely affects the rest of the family. And yeah, that's all I'll say.
Mika, I see your hand up again.
Yes, I'm going to shut up after this, but I'm very passionate about maternal health as well. So just meeting with doctors who, are, working as far as OBGYNs in this space. I've talked to them about addressing implicit bias as well. But also maybe formulating community resource lists, because we find oftentimes that birth workers are collaborating and coming up with resource lists, but it doesn't often make it to the start of where our clients are coming from. And so also, I've noticed that dealing with maternal health in moms and children is that sometimes there's a disconnect when it comes to education with WIC and SNAP. A lot of moms that come to me, particularly those in marginalized communities, don't know that they can use their SNAP and their WIC benefits at the farmer's market, and that they have the double up program. That is a big, big, big question that I always get, or just like, oh my gosh, I can. And so I have to educate them, free of course, and send them to the farmer's market. But then there's also the stress of how do I shop at the farmer's market? And so, I have to kind of reel them in there and educate them on that as well. But holding our medical professionals accountable is really, really important to me, but also listening to women. When a woman tells you, when she's pregnant or the time that she conceives that she's having an issue, you should believe her. 80% of maternal mortality can be prevented by number one, listening. And I'll also say that when government in particularly are establishing these like birth equity boards and whatever maternal health boards, is very important for not only RDs and nutritionists and doctors to be present, but also those of the grassroots organizations that are helping these mothers, children, and families as well.
Thank you. So true. Listening is super important. I want to make sure that we get some of the Q&As that are online. There's one for you, Marco. It says, do you have a success story or strategy you can share about working with BOS for land? It sounds like you must have created great partnerships and motivation among your BOS. Nice work. Do you have some recommendations on working with BOS for land, Marco?
You might be confusing me with someone else because I don't work with BOS. What does BOS stand for?
I'm not sure. It was an anonymous post. Someone put that in the Q&A. So, okay. So, and the other two, I'm going to group them together because we're running a little bit small on time. One is asking about colleges and universities and how they can better prepare to work with communities. And another one is asking about establishing relationships between state level folks with local level folks, and how can they work together without the relationship feeling extractive. So kind of both the same, how can people not in the local level come and work with community members?
We just ask folks to pull up. Like, we literally have a work day schedule, and we really do a call to action for most of our needs. So we invite people that don't stay in East Knoxville into the collective to help out. But, we do have a type of decorum that we have, allies and abolitionists and other folks follow so that they know how to operate in Black and marginalized spaces. Like, that is a must for us because I think is it Diane? Yeah, Diane mentioned, the extraction. We also, historically have issues with infiltration of Black-led organizations. And so, we do a lot of training when it comes to how to operate in Black spaces as an ally or government official. We only operate with, collaborate with like one quote unquote government entity, but they understand their lane and their role. And they also just ask simply, how can we help? And we tell them without it being a transactional relationship or an extractive relationship, if that makes sense.
With the question that asks about colleges and universities, I will say that one of the things that I experienced back when I was in college, was just quite some time ago, but something that I did encourage my students to go and do, it was a poverty simulation. And I don't know if they're on every college campus or anything along those lines, but for the students of mine that did participate in that, and me personally, that was an eye-opening experience for many of them. And I don't know that that really answers any questions, but that was something that to be able to see the resources and if you're going to be working in a community, what are the resources that are available? What are some of the challenges? And so that was just something that came to mind really quickly with that question. And as far as telling stories, we do try to lift up folks on the ground as far as our meal programs, whether it be school nutrition professionals. We have a storytelling team at No Kid Hungry nationally, and they like to let folks know what's happening on the ground as we see it.
Well, go ahead, Courtney.
No, it's fine.
Okay, I just want to make sure that we give people an actual physical activity break before we move on to our next sessions. A big thank you to Marissa, Courtney, Mika, and Marco. We truly appreciate the important work that you're doing in your communities, and we all aspire to do more of the work that you're doing so that all people can have healthy, nutritious food choices at their tables. So thank you again, all of you.
Welcome back, everyone. That was a wonderful panel discussion. And now we are going to be moving into our last but certainly not least speaker of the colloquium. So it is my pleasure to introduce Dr. Deidre Grimm. As a food justice advocate, social scientist, planner, and activist, Dr. Deidre Grimm is one who does not believe in defeat, loss, or excuses. She spent the majority of her life working on dismantling systems and activating equity worldwide, but her roots are deeply embedded in the South. She calls herself a lifelong learner because her mom and her grandma taught her that an education is something no one can ever take from you. Dr. Grimm grew up in South Carolina, where her passion for equality and equity took root at a very young age because of her family's dedication to activism and service. She is the wife of a retired Army veteran and mother of 3 sons and 1 daughter who have all taught her patience and diligence and have embedded her life even more in service to the community. Over the last decade, she has worked in nonprofits where she ensures that every person she comes in contact with receives a hand up. In her spare time, she loves to study the beautiful landscape. She loves to study the beautiful landscape of Savannah, advocate for equity, and volunteer with organizations that work to change the trajectory of the next generation. Dr. Grimm is the CEO of Ivory Bay Community Development Corporation and most recently named the first Black executive director for Forsyth Farmers Market. Deidre believes that when she is working towards is much greater than herself. And just as Vice President Kamala Harris teaches, if you are fortunate enough to have an opportunity, it is your duty to make sure other people have those opportunities as well. So thank you so much, Dr. Grimm, and I'm going to let you take it away.
Good afternoon, everyone, and thank you for staying with us. This has been a very informative session. Thank you for that wonderful introduction. It is 3:58, so I'm just going to give everyone the caveat. My supervisor is here. That's my 5-year-old daughter. So if noise occurs, that's what happens. But we, needless to say, are here to talk about the work and how we can continue to use research methods as a means to advance and address food inequities. Can everyone see my screen?
Yes, we can.
So I like to take everyone on a roadmap. But as the young lady said that I grew up in South Carolina. My background spans a lot of like our presenters earlier today around urban planning as well as public health. So I like to talk about words. I'm a linguist. My grandmother was a dean of business, but I like to talk about words. One thing that I found interesting today is the young lady, I believe her name is Femeika, said that she does not use the word empower. I loathe the word. Empower is a word that I'm doing the best to erase from multiple vocabularies across the world. The word empower implies that a person does not or did not have power. And this is highly inaccurate because especially people of color, they have always had power. We lacked political will and had systemic oppression and racism that kept us from actualizing power. So therefore, empower is not a word that I commonly use. Preferably, I use words like liberate, emancipate, and evangelize. It just really depends on what the topic is, and I can go in further detail later in reference to that. I also don't use the word food deserts. Food deserts gives the assumption that These are a natural phenomenon. But food apartheid underscores that the inequities to access healthy foods is a result as a result of decades of discriminatory planning and policy practices. So therefore, food deserts is not a part of my vocabulary. Also food sovereignty. The first young lady that spoke today, I believe her name is Dr. Jazz. She did a great explanation of food sovereignty, so I won't go through that. Food justice, she also touched on that. But I also believe that, as she said, healthy food is a right and that all people should have access to it, no matter their race or socioeconomic status. But one term that I have been fortunate enough to work with someone to help coin was low wealth. I use the term low wealth as opposed to low income because income and wealth cannot be used synonymously or interchangeably. Income is traditionally seen as a steady money coming in, and wealth represents savings and assets that could sustain a family without additional work. The COVID pandemic showed us very well that wealth matters, and more importantly, that wealthy people were more financially stable than the essential workers who bared the brunt of the crisis. So, food is community, and why do I say that? Well, I'm a Gullah Geechee woman. I grew up outside of Charleston, South Carolina, which is a place called Walmala, very small. But if you ever saw the show called Gullah Gullah Island when you were younger, that's my home. The Gullah Geechee people are descendants of Africans who were enslaved on rice and indigo plantations and on the Sea Island coast where cotton plantations flourished. So it goes all the way from Wilmington, North Carolina to a little bit past Jacksonville, Florida. In that spiel, our farming was how we lived, right? My ancestors' diets consisted of foods that were locally sourced, such as vegetables, okra, rice, yams, bene seeds. If you ever go to Charleston, get some wafers, and foods that were introduced by Native Americans, such as corn, squash, tomatoes, and berries. My mom, she was a farmer, even though she was a dean of business. She didn't grow just enough food for our family, but everyone who lived around us. And so food helped us as a people to build relationships and a means to barter for services if our household did not have the expertise. And one thing that I think of as food is relational and food is love. I believe that love is an action word. So therefore, equitable access to nutrient-dense foods is very imperative to the sustaining of not just your household, but our neighbor's household and for generations to come. So I liked how Femeika talked about gardening, right? Our community's gardens were staples. Historically, each community member had their own gardens, but unfortunately, there are now few and far in between. Gardens were used as a tool to help ensure that households did not go hungry. Here recently, I've been able to see that there has been some movement where my generation and the next generation get very involved in the land and working the land and understanding that the land is power. Here recently, unfortunately, across the water in Hilton Head, South Carolina, there's one of our elders who is fighting to keep her land from developers. She tilled that land she's about 93 years old now. She tilled the land since she was a child, and now they're about to take it. And so, unfortunately, heirs' rights and heirs' property has been plaguing our community, so we lose those at astronomical rates, as well as Black farmers are dying off faster than any other farmer. I also see this movement in growing our own food and self-actualization of Kujichagulia, which is one of my favorite Kwanzaa principles. My youngest son was actually born on the day of Kujichagulia, so that's probably why why it's my favorite. And so it speaks to self-determination and that we must ensure that we take our power back into our food system. Also, low wealth and minority communities are plagued with heavily processed food outlets such as dollar stores, fast food chains, and convenience stores. I know that there was an article written here recently around how dollar stores do their marketing analysis, and they come into low wealth and minority communities. But when I was getting my doctorate in Irvine, there are alternatives that could be implemented here or in the southern area or any rural areas if there is the political will involved, right? There's something called Dollar General markets that have fresh produce in them. They have access to organic meats, but yet and still, when we lobbied and advocated for that to happen here in Savannah, it was told to us that that couldn't happen. So I know as a planner that I believe that food apartheid is by design, and it's not ironic or happenstance that the descendants of formerly enslaved Africans lived in these areas. And these are areas where there are high issues of pollutants, chronic illnesses that are diet related, but also airborne, like asthma. These are communities that we have to fight off environmental injustices. If you know anything about Savannah, it's a sleepy town on the southeast coast. But when you take a look back and peel back some of the layers, the injustices that happen in communities that are near and dear to me are the ones that are facing all of the disproportionate effects of health-related and diet-related illnesses. Coupled with wealth inequities, many of my sisters and brothers do not have the same time to prepare healthy meals, and they rely on what's fast and easy. And unfortunately, that normally comes in the forms of greasy foods, foods full of sodium, that are sugary and heavily processed. As a person with lived expertise, I like to set the stage and tell anyone that I have been in the same situation and that I'm no better than the clients and the people that I serve. As a young mother, my oldest biological son is 19 years old. So I had him my sophomore year of college. And I was busy with life, work, school. My husband was in the military. He was off on duties. And I had to do what was easy. While I had a support system, sometimes I did not like to ask because I didn't want to bother people. So unfortunately, it led to me becoming morbidly obese. I used to weigh over 300 pounds, and I just got to a place where I was tired. I couldn't live like that. I couldn't run behind my boys anymore. It was just so exasperating and drastically affected my health. And so I said I knew that I needed to make a change. Well, the universe will make a change for you if you don't. And unfortunately, I had to quit my job because my morals would not allow me to stay in the role that I was in at the moment. And so while that created some other challenges, my health was able to flourish. I was able to get to a healthy weight. I was able to maintain it and be stable. I was able to run behind my children and play soccer with them. But that took real initiative and real thought. And when I think about what my counterparts may be having challenges, there are, like I said, food apartheid areas. There's no access. Maybe they don't have a card to get to the grocery store. And that's not a realistic option for them. So they just have to do what's easy. And right now at the Forsyth Farmers Market, we're doing our best to make the healthy choice the easy choice. I like how the young lady talked about being a disruptor. Ironically, I named the Wi-Fi code, Wi-Fi in my house disruptor, because I'm here to dismantle the systems of oppression. And I know that it's heavy lifting and I can't do it by myself. But there are all these myths that talk about why people are unhealthy. So as a researcher and analyst, I like to talk about the numbers. So right here we see the vast majority of those experiencing hunger are in vulnerable populations. These are people that normally can't take care of themselves. We have children that make up at least 41% of those who are considered in hunger, and 10% are seniors. So over half of those populations experiencing hunger are in populations that really cannot have the ability to serve themselves. So I'm not certain what your school of thought is, but personally, I push back on the notion of a stomach full is a stomach full. My body tells me when I need to eat something different, when it's time for a salad or a smoothie or water or a nutritious meal. So therefore, I believe in this space, we have to be intentional in what we provide to those who are experiencing hunger and poverty. In a previous role, I was able to help our local food banks, food pantries, and soup kitchens with their procurement processes, and work directly with local farmers to provide fresh produce to the food banks and food pantries and soup kitchens. So therefore, I challenge all my peers that work in these spaces to elevate their work to ensure that they promote the healthy options to their clients. I applaud the efforts of our local food bank here in Savannah. One thing that we have used is a Fresh Express model. So all of the fresh produce that we get from local farmers, grocery stores, or growers, it is donated to nonprofit organizations, and it is given away weekly to the community. And I also think about those students, who are going hungry during the summer because of the long break. The statistics show that 6 out of 7 students are hungry over the summer because they don't have the summer meals or the school meals, breakfast and lunch. And as we can see that lately, the administration rolled back where free lunch that was accessible to all has been transitioned out. And so we're also seeing where families are not turning in the school nutrition applications. And as an organization, we work with parents to make that easy. We help them to do SNAP renewals applications as well as school lunch forms, because SNAP is a means to help quell hunger. And regardless of what some of people may think, only 2% of the whole federal budget is allocated towards SNAP. So you just think about that, 2%. In a country that is, we're experiencing inflation, but we have not experienced real lack, right? So if we could, make a charge to expand some of the PEBT benefits, I know that was handled on the state level. Unfortunately, we lost ours, but there are some more forward-thinking states that continued theirs on to provide these benefits to families. We're able to help quell hunger. But what I found interesting about this data is that while Blacks represent 21% of all of those who are experiencing hunger or poverty, we only make up 26% of all SNAP recipients. And then conversely, while 8% of all experiencing hunger and poverty are white, that accounts for 37% of those who are receiving SNAP benefits. So, this is a hard topic to talk about, but that notion that Black people are lazy and don't want to do something for themselves, this dispels that right there. I grew up in a household that my grandmother was very proud. So if we were to fall on hard times, I doubt very seriously she would ever have, done a SNAP application. But it also shows that SNAP benefits, as a person that someone has utilized SNAP benefits, most of these people, especially my community, is using these benefits towards food. Sometimes our benefits didn't even stretch at that moment. So I was so fortunate to have a support system to rally around me to ensure that we were able to have balanced meals. And the topic that we are here to focus on is research methods. And I'm going to talk about a majority of different research methods. The ones that I prefer personally are the socio-ecological model. I use this in my practices and tools because it looks at the individual level, which talks about how is this one situation affecting one person. So the question is to me was, how is living in a food apartheid area, affecting one person, right? It is probably affecting them in a rate, in a manner where they're not able to take care of themselves and be able to access healthy foods. But if it's a child, this should always look at the household finances, right? Because they're not taking care of themselves. Then on the second level, it's a relationship level. I like to look at it as a familiar level. One study that I did was on how the lack of healthy food options in a household affected a child's behavior at school. I was able to look at behavioral situations that occurred in school. And it was because children couldn't focus because they're eating sugary diets. They are lacking the nutrition dense foods that normally would occur in another household. And then you talk about the relationship because the family is doing, if one child is having this problem, then everyone else in the household is having the problem, right? So the parent possibly is not able to be there to provide these meals. And then also on the communal level, which I look at the neighborhood, then how many other families are experiencing this? I'll give you an example. Here in West Savannah, Savannah, Georgia, it's about 25,000 people there, but you have enclaves of 80 to 90% poverty, while the city of Savannah has a 30% poverty rate. So that means that there are many households who are living in food apartheid areas that cannot effectively feed their children nutrient-dense meals. They're going to schools and they're being labeled troublemakers because of issues that they cannot control. And then let's talk about local government, right? The societal level. I'm going to talk about local government as opposed to national at this moment. We have a majority African-American council, and yet and still there has not been done enough to address food apartheid areas. I work in the space where I contract out with convenience stores to provide fresh produce in stores. We also have a mobile farmers market. We have the 912 food pharmacy program, but yet and still that's not enough, right? I think Dr. Kofi spoke about the political will, and the political will must be coupled with genuine intentions, where policymakers or elected officials and leaders stick to what they need to do as far as moving the needle forward to address these areas. And so therefore, we see that hunger has a ripple effect. It doesn't just affect one household, it affects you as well. I like to talk about equating it to money, right? In Savannah, locally, we could have saved $31 million in unnecessary hospital visits if there had been done more in food and addressing food and nutrition insecurity. You just think about what you could have done, what we could have done with $31 million. We could have eliminated some of the debt that is incurred to our farmers if we help them with rotational crops. We could have had families to be able to financially sustain themselves where they can afford the foods themselves. And so that is a large number in a city of about 150,000 people, where over 55% are Black. Then I moved to participatory research. Number one, participatory research must be community-led. I heard my colleagues talk about the community knows what they need. If you want to know what someone needs, just ask them. They'll be more than happy to oblige you and tell you what they need, because it's not about us, it's about serving the community and meeting the need to ensure that the next generation does not have to have these issues. And listening is pertinent. I tell anyone, I take off all of these letters off behind my name, and I'm just Deidre. The highest thing that I can ever be called is sister. I don't need the doctor. I just need my community to be good. And so listening to genuinely affect change is what's needed. I live in a household where I have some wonderful people, i.e. my oldest son who's studying to be a lawyer. He listens to come up with a response, but listening and sitting back and fully digesting what people are saying, as well as listening to their thoughts on how to remedy it, that's what we have to fully engage. And I tell anyone, lived experience trumps all theories, case studies, anything that you can think of, because that is what is important. At the end of the day, I could not do this work without having walked the shoes that I've walked in. I could not do this work without my ancestors being able to propel this work and magnify this work so that I have some kind of foundation. And so therefore, the next generation I am excited about, because when they have people such as others on this panel, they're able to come into a space where it is welcomed and understood that a bottoms-up approach must be utilized. We live in a top-down society where everyone at the bottom gets the crumbs, but it's the people who were at the bottom should be the first at the table. I practice asset-based community development when I work in the Ivory-based sphere, because you can go throughout a community and see how to build upon what they need financially and economically to incentivize and effect change, even in the hunger sphere. And then next, focus groups. These are ways and opportunities to engage and build lasting, genuine, and sustaining relationships. Relationships that transcend even me leaving the space. I share a story about Miss Annette Archie, who recently passed. Miss Annette Archie was one of our strongest supporters. And she ensured that every community member that she knew about the farm truck, knew about food pharmacy, as well as saying, oh, you can trust Deidre, you can trust Tasha, you can trust Mark, because she knew that word of mouth spoke volumes as opposed to an ad on a TV or on a bus. In my community, it is about who are your people. That's how they know to trust you. They know what your intentions are. And people can read through the lines. They can tell if you are just scripted or if it's honest. Also with focus groups, they build and cultivate a judgment-free zone. I like to let everyone know that I am no better than the next. I have been in these positions and I'm here to listen as to what I can do to assist you out of the position. So therefore, we start off with a shared meal. We start off with being vulnerable and transparent while staying professional. And then we also move to having listening sessions, and asking probative questions after hearing what has been said. And when they see their peers that are sharing, then they are more likely to share. We also hear that families are able to, families are able to share and more likely to share when they feel that this is a safe space. So anything that Forsyth Farmers Market does, anything that Deidre does, it is with the notion that what is said here stays here. And here recently, we have been able to do some more, do work within the Hispanic community. And that came about utilizing relationships that were already built in the community. I am not of Hispanic descent. So therefore, I relied on my peers that have built relationships to welcome me into their spaces. I never walk into a community thinking this is my space, regardless of if I'm Black or not. People here in Savannah, especially in the Gullah Geechee community, will tell you, don't come here if you ain't from here, right? So there's a come here and a from here. So I'm grateful that I am a from here. But when I moved to Savannah, I had to build relationships with people who were from here so that I would be welcome in those spaces. So this is what I continue to underscore. And then I get into the space of those areas that are questionable. Personally, surveys are a necessary tool in elevating and progressing the work. Unfortunately, like Femeika was saying earlier, just handing out a piece of paper and or a tablet is not going to do it. You have to build a relationship in order for someone to answer your questions properly and not be resistant. We all know that data can be skewed. Therefore, if you want true and honest answers, the relationship building is key to getting those honest answers. I have been on the other side of things where you give I've been given a piece of paper and I just jot down anything because I just want to keep on going. But if we are really intentional about the work and in ensuring that the data is sound, then we build relationships while giving our surveys. Ethnographies. I am a proponent of ethnographies. Matter of fact, that helped me through my thesis and while I was working on my urban and regional planning degree, master's. But the researcher must understand the culture or be culturally competent or be directly from the community. If not, some of the practices would not be understood. And so therefore they could be demonized. We have seen this in African traditional religions and how those were used as a tool to sustain slavery, right? These are not ways that we want to continue on, right? We want to shift the narrative. And unfortunately, experimentation in the Black community, that has not always gone well. We know the story of the Tuskegee experiment. We know the mosquito, you all may not know about the mosquito experimentation here in Savannah, but it was where the military came in West Savannah and let mosquitoes out to figure out if malaria or any other diseases would be prevalent in African-American communities. So we have been, unfortunately, the subjects of atrocities, and such as James Marion and his experimentation on Black women, while he is still considered dubbed the designer of gynecology. These are atrocities that continue to affect and traumatize Black people, even to the point where we've seen there's this mistrust in receiving the COVID vaccines. So if we want to ensure that our methods are sound and our methods are just and our methods are honorable, more personally, I moved towards utilizing the focus groups and socio-ecological models and participatory research. But there are ways to couple or work in these other spheres, whether it be surveys, ethnographies, or experiments. But it will take a lot of relationship building and trust to move forward. So I had the pleasure of happening into the public health sphere while I was studying for my master's in public policy and urban planning. And so I went back to school after receiving a doctorate to get an MPA with a concentration in public health. My husband thought I was crazy, but I knew I needed to understand it. I had a few classes, but I saw where the upstream approach is what needed to happen. And so I like to talk about the root causes of hunger first, right? Hunger is systemic and hunger is multifaceted. We've heard that today. Listening to everyone's presentations, I was so happy to know that I'm not the only one who is experiencing some of the same issues, but seeing these overarching themes and they continue to work together in tandem. But I suggest that we use the social determinants of health as a guide so that we can truly combat and eradicate hunger. And number one, until we address the wealth gap and access to income generating resources and opportunities, we'll continue to perpetuate the same cycle of nutrition insecurity. We live in a capitalist society, therefore, low wealth families need more opportunities to entrepreneurship and high income generating employment. There have been conversations about raising the minimum wage, but that's not all in all, right? Because with inflation, we're seeing that depending upon the household size and location of where you live, $15 isn't going to go far. It's more like $30 as a starting point. But we do understand that that may not be reasonable, but if we want to truly address hunger, and we have to tackle the issue of lack of access to capital and funding opportunities. Then we can talk about the access to healthy food outlets. I purposely used this map in this slide because it only accounts for supermarkets and those who do not have cars. Public transportation in the South is usually less consistent and stable, even in urban areas. I know that when we first moved here to Savannah, I had to wait 2 hours for a bus. After living in California, I was like, this is insane. I'm not doing this. And I asked my husband to go get a second vehicle. We were able to live in California with one car, but that is not optimal here. So therefore, there needs to be done and to ensure that the grocery store also is not the silver bullet. We need to take into account that not all people have access to vehicular transportation, because biking and more walkable spaces is really the way to move, because that gives physical activity coupled with healthy food outlets. We're able to create that and cultivate a healthy weight within our community. I'm not here just to promote farmers markets because I lead one, but I'm a proponent of open air markets, period. I know where my food is coming from. I know Farmer Joe, I know Farmer Helen, I know Farmer Adam. I know what their practices look like. And I can't always say that about grocery stores. While I know some of my farmers do vend to our local grocery stores, I believe in these small local settings because there is economic generation that goes directly back into the community which they serve. So therefore, my money is in a circular pattern because it's moving from my hand to my farmers, back to their workers, back into our food system and into the local restaurants and other outlets here, even our hospital system. So I look at creating generational wealth, and a farmer's market can be used as a tool to do that. The grocery store, unfortunately, continues to support the Big 10. And we know at the end of the day, the Big 10 is not in business to help the small farmer. And as someone who is an educator and an academic, I believe that education is imperative, right? Educating our community on why we're eating seasonally, locally sourced food, and how does that benefit their health, and how is that better for them, is what we have to do. Also, educating that the community that healthy eating does not have to be expensive. There is this thought that healthy eating is expensive, but it does not have to be. I'm grateful that at our market, we double SNAP benefits, but we also meet people where they are. So some of our farmers have this pay what you can model. So we don't look at to price gouge, we don't look at inflation and gouging people, because we know that everyone is hurting at this place. And we use education as a tool to build community and relationships. That has made sure that we're successful in ensuring that our community is first. And our community informs our education, whether it be recipes, whether it be food demos, our classes, anything that we do here, we hear first from the community. And I like to underscore right here that all of these systems that I previously mentioned, they breed crime, unfortunately. My husband is former military and law enforcement. So therefore, he and I have had many conversations with those who have been incarcerated and that are currently incarcerated and formerly incarcerated. And most convey that they committed crimes because they could not take care of their families. More specifically, feed their children. I have had gentlemen break down to me and explain to me that they resorted to a crime because they rather take the risk of being able to provide some financial benefit to support their families than to not do anything at all. And as a mother, I shudder to think what that really would look like. If we were in a position, if I was in the position to have to make that choice. I was fortunate to have that support system, and I provide that support system to everyone who I come in contact. But if I didn't have people rally around me, I don't know where I would have been. And I always talk about being proactive, right? Using the public health lens teaches us to be proactive and work towards prevention. As stated before, nutrition insecurity is multifaceted. So we have to build strong relationships with community members, organizations, elected officials, and funders to support the work. And when we're talking about funding, our research and our data is what drives funders to even support the work more. They want to know about their impact. They want to know where their dollars are spent. And so therefore, when we're getting accurate and true data, we're able to say, hey, this is where your money went, and we're able to sustain this work and continue it on. And genuine interactions. I like to look people in the eye. I like to smile, but I like to be honest. I like to always present myself as humble and make sure that I am interacting appropriately. And I like to also advocate for funding for our farmers, co-ops, and farmers markets. That way we can address the racial inequities. So I would be remiss if I didn't leave you with some actionable items. And as you all know, I work for the Forsyth Farmers Market. We're known for our flagship market that happens rain or sun, rain or shine every Saturday in the middle of Savannah from 9 to 1. And we ensure that we even leave our space with food from our farmers if they brought more than enough. We take that back, we aggregate it, and put it back in the community on not just our farm truck, but here recently we started a community share box program, and it's called a farm share box. And I'm proud of it because it retails at between $40 and $50, but we only charge our community $10 a box. And they're able to use their SNAP benefits towards that, as well as our food pharmacy program. We started off with around 170 members. Unfortunately, because of the situation that we're in, we have over 550 people enrolled in our food pharmacy program. And that's in less than 9 months' time. But we make sure that we meet everyone at our stops. We work with partner organizations within the healthcare field to give those scripts off our participants, and we're able to give them their produce at the end of our clinics, as well as giving them education. And the farm truck, we currently have 12 stops, specifically in low wealth communities. We're expanding to 24 here before the year is out because the need is so dire. And as you can see, the education and outreach never stops. We have garden initiatives where we work with our school system and bring the garden to the schools as well. And I know that I am running out of time, so I want to leave you with the last few things, right? So health services, food is medicine. Our food pharmacy program is a tool that can be utilized and replicated nationwide to ensure that households have what they need in the form of food as medicine, and keeping down that $31 million of unnecessary hospital visits. Program development surrounding education and access, ADAWA, which stands for A Taste of Old African Heritage, where we teach the community about the culturally appropriate foods that our ancestors ate, and get back to those old food ways and heritages and practices that they did to sustain themselves. I will leave you with one thing as well. My grandmother, when she passed last year on my birthday, even though she had the audacity to leave on my birthday, she was 105. She was not on any medications. She was not on, only thing she did was she walked with a walker. So I know that this works as a tool. And our food as medicine has been shown that, our Now and Two food pharmacy has been shown that some of our participants have gotten off their diabetic medicines, their high cholesterol medicines, just by utilizing the program. And policy and advocacy go a long way. I'm so grateful that we have FRAC and Georgia Organics as collaborators in this work, because they're able to lobby our elected officials and talk about the issues that are going on here, specifically in low wealth communities and in Georgia, and also underscoring that research is imperative and research is key. But we also must use that, as in Pillar 5 says, to enhance our nutrition and food security research. Relationship cultivation is a must. So I hope everyone, I was able to bring some new thoughts after all of the wonderful participants before me stole my thunder, but I was so happy to hear that I am in great company in this work. Thank you for having me here today.
Thank you so much, Dr. Grimm. I really appreciate that talk, and it was a wonderful conclusion. And we do have some time for some really awesome questions that we have in the chat. So you talked about using the African Heritage Food Pyramid with the population that you're serving, but have you ever taught that or provided education on the African Heritage Food Pyramid with those outside of the population that you serve, so people are understanding of what that looks like?
That's a great question. So one thing that we definitely work in Spears is that we believe that we cannot do this work without our allies and accomplices in this work. The founders of this market, where I think it was 6 women. Of course, you always ask the woman to get a job done. 1 was Black, 5 are white. And they are the ones who pushed that we looked at the African heritage food pyramid. And so we work with local chefs to replicate these in their classes. Our classes are open to all. Our 912 food pharmacy, we replicate these models there. And so we do have people in our spaces that are not of African descent that take part in these classes. So short answer, yes, because we understand that this method has to be replicated, especially living in Savannah. So yes, we definitely educate the community far and wide about these.
Yes, and to your point of saying, your grandmother living to the age that she lived to, when we look at kind of the research around the blue zones, it's diet. It is diet that helps us live to an old age. And then I kind of look at where my grandmother's at. She's in her early 80s and not doing so hot. But I also look at the food choices that she had access to and that she ate during her life, and how maybe if there was something she did differently with her nutrition, that maybe that would help prolong and the quality and quantity of her life. And so that really struck home to me when you were saying that. And how we can educate others on traditional cultures and how they're eating and how that promotes health, because food is medicine. But we also had a question from Femeika, one of the panelists, and she asked, do you practice the art of Sankofa within your community and those who want to work with you?
Femeika, stay out my head. So yes, we do.
And can you explain what that is for those in the audience who don't know?
So Sankofa looks at the principle of going back to where we came from to go looking forward to where we're going. And so I think that that's a more generational approach, right? So as you can see, my daughter's here in the office, and I know you all heard the noise back here, so please forgive me. But we take the garden, we take our young people to the garden with us. We take our young people on farm tours. We take our young people to the farmers market and help them understand that farming can be a lucrative career. There is this thought that farming is only for people who are destitute and they are not going to make any money. But we have farm vendors, even Black farm vendors, that make at least $3 million specifically at our farmers market alone. Yes, you heard me right. Did $3 million. I told my husband, I was like, we got to get back home because I'm in the wrong business. I need to be at the market generating money. But needless to say, yes, we definitely, make sure that we remember where we came from and make sure that the next generation has those tools to move forward. Because what worked for our ancestors definitely can be replicated and work for us. It is just, it takes a lot of heavy lifting. And I know she understands that because it's not as prevalent as it was. And it's so very hurtful to me. But I take a garden everywhere I go. Unfortunately, every house that I've lived in, the people that move in, they move in with a garden. Here at the farmers market, I'm in the office right now. There's a young lady who has a farm outside. We have farms next door, and we offer grants and opportunities for farming. So some of our chefs, they farm and they educate the community on how to farm as well too.
That is really amazing, because I know when we talk to kids, like elementary school kids, what do you want to be when you grow up? A doctor, a lawyer, an astronaut, all the things, but you never hear farmer. And if we could show kids how that is a sustainable and practical job that they can have, and they can make more money than some of those professions, it might help kind of change that mindset. Like you said, we tend to think of farmers as like they have to because there's no other option, and that's really powerful, is showing kids that that's an option when they grow up if they want to be a farmer. So I think that's fabulous. There was another question, and I'm not sure what state that this participant is in, but she asked if your farm truck accepts WIC, because they're having a really hard time getting their farm truck vendor to accept WIC because of state regulations.
We're in the same position here. Unfortunately, Georgia is not as forward thinking as I would like them to be. In California, we were able to do that easily. We've moved to the card here in Georgia. And so one of the things that I did approach our Senators Warnock and Ossoff on was helping us to be able to take that off of our farmers. Our WIC vouchers can only be used directly with some of our farm vendors, which they have said that they do not want that burden. And so as a market, since we already handle SNAP, it would make it a seamless transition to do so. And so maybe you and I, we can coordinate on how we can lobby to make sure that that happens, because we are losing, we're losing out not just on funding for our farmers, but access to food for our participants. And I am a trained CLC, so I believe in breastfeeding. And one thing that I want to do is create a mama's market here. It's been replicated in Louisiana and other states in the Gulf Coast. And we need to do that here as well.
I love that. And as maternal and child health people that we are, I'm very happy that you said that. I actually just spent all morning at our breastfeeding symposium. So I'm so glad you said that. And then we have someone that's actually in South Carolina. And she asked what your coverage area is, because she's trying to find resources for their patients.
Sure. If you could ask her specifically where she's in South Carolina.
Medical University of South Carolina.
So she's back home in Charleston. So a lot of our farmers do come from the Charleston area. So I'm quite sure that there's something that we can work out to expand food pharmacy. What we are trying to do is bridge a gap between maybe the Charleston, Walterboro area to extend all the way to Brunswick. Here recently, we have been notified that we are considered a food hub. And so our work is expanding. So I would definitely love to partner with her, as well as one of my favorite dietitians is at MUSC. So I have great respect for them there.
Wonderful. And I'm sure that participant, I found you on LinkedIn, so I'm sure they can find you on LinkedIn and connect and get some conversation going. But I just wanted to thank you so much for ending us on a very wonderful note, and really sharing that insight with us. So thank you so much for joining us today.
Thank you for having me.
Yes. And now I'm going to go ahead and hand it over to Emily Holloway for our call of action.
Hello, everyone. Thank you so much for those of you that have been able to be with us for today's colloquium. We are so thankful that you are here. So on behalf of the University of Tennessee Maternal and Child Health Team, I would like to extend a gracious thank you to our speakers, panelists, and moderator for giving their time and sharing their knowledge with us. I would also like to thank all of our attendees who are here with us today. We appreciate your time and sacrifices to be here and learn alongside of us in our final Promoting Healthy Weight Colloquium series, focused on strategies to achieve hunger, nutrition, and health goals. Today's colloquium and presentations would not have been possible without the pivotal White House Conference on Hunger, Nutrition, and Health that took place in September 2022. The national strategy included pillars and actionable steps to serve as a guide to end hunger and reduce diet-related diseases and disparities in the U.S. The 5 pillars: improving food access and affordability, integrating nutrition and health, empowering all consumers to make and have access to healthy choices, supporting physical activity for all, and enhancing food and nutrition security research, all of which were emphasized in the presentations, panel discussion, and activity breaks we participated in today. I hope that each of you got out as much of this colloquium as I did. Hunger and diet-related diseases impact the maternal and child population at all levels of the socio-ecological system. Our speakers and panelists spoke on building community partnerships to improve food systems and moving toward food sovereignty by identifying actionable steps to help make food systems more equitable, especially among historically marginalized communities. In addition to increasing access to nutrition services, diversifying the maternal and pediatric health workforce, and enhancing and diversifying research around food and nutrition security. From the knowledge gained today, we hope that everyone can identify at least one actionable step that you can use in your community as we move toward ending hunger and reducing diet-related diseases and disparities. We believe that in order to achieve these goals, we must build partnerships and identify collaborations across interdisciplinary teams to identify sustainable interventions and programs to help meet the needs of the diverse members of our communities. And finally, today's colloquium does conclude our series on promoting healthy weight among the maternal and child population. Please stay tuned via updates through our listserv or website for details in the coming months about our new health equity intensive course that will begin in spring of 2024 and will occur biannually. Thank you so much for attending, and you will receive a post-colloquium email that will include a link for evaluations. Thank you guys so much.